Good morning, distinguished guests, esteemed speakers, and valued participants. I am Ananta Sharma, a member of the Global India AI Summit team at the Ministry of Electronics and Information Technology, Government of India. It is my honor to welcome you to the GPAI convening on global health and AI. Today, we have gathered here at Bharat Mandapam, New Delhi, to embark on an insightful journey discussing the integration of AI into healthcare, particularly focusing on the unique challenges and opportunities within the Global South. As we know, the Global Partnership on Artificial Intelligence is a multi-stakeholder initiative that unites leading experts from science, industry, civil society, international organizations, and government. Our shared vision is to promote trustworthy AI while addressing pressing global challenges such as global health, which is a priority area for GPAI. India, as the lead chair for 2024, is proud to spearhead numerous GPAI initiatives, including today's convening. This event aims to provide an opportunity for AI practitioners and policymakers to showcase their work, deliberate on the unique context and challenges of integrating AI in healthcare, and develop potential new directions for GPAI's future endeavors. Today, our focus will be on three critical pillars identified during our recent domestic consultation, that is, data quality and accessibility, digital infrastructure, and regulatory and legal frameworks. These issues are particularly relevant in the context of the Global South, where high-quality, reliable data and robust digital infrastructure are often lacking. Through our discussions, we aim to understand global viewpoints, learn from best practices, and explore how these can be adapted to improve AI implementation in low-resource settings. Before we begin, I would like to introduce our distinguished speakers and panelists for today's convening. We are privileged to have with us Dr. Karthik Adappa, Regional Advisor for Digital Health, WHO. Dr. Adappa is a renowned physician scientist with extensive experience in digital health, public health, and AI interventions. We also have with us Mr. Sameer Kanwar, Director of Digital Health, India and South Asia, who will be moderating several discussions for today's convening. Our panelists include Ms. Megha Chaudhary, Advisor at Brainsight AI, Dr. Sanjay Sareen, Vice President of Access at Find, Mr. Mihir Kulkarni, ML Scientist at Vadhwani AI, Dr. Mona Duggal, Assistant Professor at PGIMER Chandigarh, Ms. Jo Agarwal, Co-Founder and CEO of Vaisa, Ms. Gitanjali Radhakrishnan, Founder and CEO and MD of Adiuvo Diagnostics Private Limited, Dr. Basant Garg, Additional CEO at the National Health Authority, Sri Madhukar Bhagat, Joint Secretary, Ministry of Health and Family Welfare, Mr. Ankit Modi, Head of Products and Founding Member at Cure AI, Professor Anurag Agarwal, Head of Koita Center for Digital Health at Ashoka University and Dean of Biosciences and Health Research, Mr. Nilay Verma, Co-Founder of Primus Partners, who is currently running a little late. I would now like to request our keynote speaker, Dr. Karthik Adappa, to kindly begin with the session. Yes.
Well, we probably don't still have AI to get us the clicker, so I'll get started as we get the to get the lay of the land. Essentially, this has been an effort where we've done a domestic virtual consultation, trying to identify what really are the gaps that we have in using AI in the Global South. We've had one virtual consultation. We've been able to identify three different pillars. That's something which Ananta just talked about. I want to use this opportunity to kind of talk a little bit more about deciding a framework on how do we really think about this a little more in greater detail. The clicker isn't.
Can you manually do it, please? Can you change the slide manually? The remote is not working.
Okay, perfect. Thank you. Thanks. So what I want to do is first I want to talk about what is the widening chasm between the Global North and Global South in AI. Talk very broadly what are the challenges that Global South has in using AI, and then use three different things. Use a generalized AI lifecycle, and then embed that with some core principles for trustworthy AI, and then develop a framework for identifying challenges in using AI for health. Because we essentially have a lot of wonderful stakeholders. I'm only hoping that as the organizing committee, we want to kind of think a little more deeply and essentially come out with an AI playbook. So that's our eventual goal. And this consultation is an approach by which we want to hear a variety of stakeholders. So globally, what we are essentially seeing is there's a widening chasm that we have. Probably it's better if I stand. So in terms of a network readiness, this is essentially an index that talks about how are digital technologies evolving globally. And what we actually see is that the rich countries, the wealthier countries are the ones which are able to actually utilize digital health technologies. But there are, yes, certain low and middle income countries that are making progress as well. Now, apart from that, when we then go into a little more into AI research, it's not a surprise that most of the top 10 countries are essentially from the Western or the European countries or the North Americas. We just have a splinter with India and China contributing here. But when you look into funding for AI research, that's when you see that countries like China and Brazil from the global south are representing. And it's otherwise, again, very traditional in terms of the Western and the North Americas and the UK. And this shouldn't really surprise us. But let's go into a little more into how is the global space in terms of responsible AI coming out. What is very interesting is this a very recent report that tried to look into how is the global index on responsible AI across the world. This essentially looks into all the 138 economies across 3 different dimensions, and it looks into 3 broad pillars. And what you'll actually see on this is most of the countries above 75 are essentially in North America, Europe, and Australia, whereas most of the global south is in scores less than 50. And this should, again, not really surprise us. Now, what is also very interesting is when you look into what is the potential gain that different countries around the world as regions are likely to have, again, it predicts that China is potentially going to get about 26% is going to contribute. China and the US or the North America alone are going to capture 70% of the markets. The benefit that you would gain in AI is essentially going to be between these 2 regions of the world. So with this being there, but how about our users? Well, we see now very clearly, whether it is in terms of funding, whether it is in terms of research, whether it is in terms of the basic infrastructure, you can certainly see the global not taking an upfront lead. But in terms of the country share by the users, you'd see very interestingly that the global south, there are potentially the large number of users using these large language models. So our users are continuously using AI, even as we speak, and so therefore the AI adoption scores are also fairly high. So here is a time for us to think, what do we then do? So I want to kind of, when we think very broadly, and this is something which we said from the global consultation, you would talk about this as very broad challenges for AI in healthcare. For example, we would all talk about, are we really addressing our local priorities? Are we looking to very contextual, specific healthcare problems that are unique to our area? And we also recognize the fact that we have data scarcity and quality issues. We of course have infrastructure issues. And then there are a lot of contextual differences between how you would implement AI within a high resource setting versus low resource setting. There are ethical concerns. We recognize a lack of workforce capacity, regulatory frameworks, and of course, what about the cost and sustainability? Are these AI solutions that are coming out as splinters in our ecosystem, are they really sustainable in the long run? What about the cultural acceptance? Are our AI solutions really trustworthy enough? What about interoperability issues? So you would see that these are the broad challenges that anybody would talk about. That is generally been thinking. But let's get into a little more deeper into what is essentially the gender equitability, and especially in the AIs in the global south. You certainly see a large amount of data gaps for marginalized communities. Are we having data sets that would really think about specifically the underprivileged and the marginalized societies? Do we have an understanding how gender inequities manifest in our data? Are we thinking on those lines? What about the danger of being gender blind? And most importantly, do we really capture gender identity in our variety of gender identities in our data? What about the lack of transparency leading to trust gaps? So essentially, this is again a broad framework. So what I want to do is I want to kind of think about a very high level AI life cycle. So this is something which would be common to all of you, but just for the sake of others, what typically you would do as an AI machine learning scientist is you would first think about defining a problem, designing the AI system for that specific problem, engineer an AI solution for that, look into assessing it. You would go into a clinical setup, you would go to a lab, assess it, and then you would pilot it. You would think about what is the right kind of clinical environment where I can pilot, and then you would try and deploy and monitor it because you want to look into seeing if the efficacy of the tool is a sustainable one. So this is a very generalized life cycle for any AI platform or any AI solution. Now, these are some solutions. These are some core principles for any trustworthy AI. Now, anything that you would want to do, you'd want it to be useful to the user. You want it to be used in terms of usability, in terms of efficacy, you would want to think about that. You want to think, is our solution really fair? Is it equitable? Is it safe? Is it reliable? And then you want to think about the transparency. So every model that you build, are you essentially putting out the model information out? So is it transparent enough? Is it intelligible enough? And are the ones who are building this model, are they accountable to the real stakeholders and the users? And then you, of course, would want to think about this overarching guardrail of security and privacy. Now, if that is the general life cycle, what we want to do is think about a framework. Collectively, what we do really well is bring out a variety of challenges. But what I want to do is I want to use this few minutes to talk about a framework, which is essentially saying, okay, if these are the general life cycle for an AI, and then we know that these could be the core principles, and of course we can expand upon the core principles, but then we also want to think about who are those stakeholders. Are we having enough stakeholders here, variety of stakeholders? Are we listening to the patients? Are we capturing what our providers want? Do we have clinicians here as a part of the stakeholder engagement? We need to, of course, involve industry, and I'm glad there are a lot of industry partners here. We have academia well represented. What about our regulatory authorities, our healthcare organizations, innovators, nonprofits, tech developers? So now here is a very interesting scenario where you know what you want to do in a typical AI life cycle. You also know what are the core principles that you want to include, and then you want to have a conversation with these key stakeholders. And essentially the goal is to put all three of them together. And then what you want to do is you want to ensure that you're learning, it's a learning health system. So you're constantly learning off each other. So what I want to do is as experts are here, I want us to think and use this framework at every stage. What is the core principle that we're trying to tackle? At what stage of the AI life cycle are we thinking about? And how do different perspectives of different stakeholders, how do we capture all their key stakeholder perspectives? Now, to just give one specific example, now just let's go to the stage of defining a problem and a plan. Now, if you think about the core principle of usability, usefulness, and efficacy, one of the first questions that we want to ask is, are our AI solutions effectively being integrated into clinical workflows? Now, think about fairness and equity. Are we trying to really avoid discrimination against specific socio-demographic groups? Are our organizations having a bias monitoring and mitigation strategy? What is that as gold standard that different organizations have? Now, in terms of safety and reliability, do our organizations have a risk management SOP? Are we thinking clearly who should own the responsibility for a safety, efficacious, and the performance of the AI solutions? Is it going to be the developer? Is it going to be the organization that's actually implementing it? Or is it who in the stakeholders is going to take responsibility for that? In terms of transparency, how do we make this model information accessible to all stakeholders? Most importantly, how do we communicate risk to our end users? So there are some very key questions that we want all of us to deliberate upon, and I don't think we have all the answers. But essentially, this consultation is a process where we want to help our country build an AI playbook. And therefore, I want to kind of lay the ground for all us to deliberate using a specific framework. And of course, it does not have to follow this, but I want to kind of share that one of the most fundamental things is we're all sitting at this important movement where there's a huge paradigm shift on the way AI is being used. Now, how do we therefore bring our solutions to our communities? How do we bring it to our patients in a way that is equitable, that is safe, and also science-based? So I will pause for now, and I'm really looking forward to wonderful conversations on this from a variety of experts that we have. Thank you.
Thank you, Dr. Adappa. We now have Sri Madhukar Bhagat, who will be talking about the integration of AI into healthcare from a government's perspective.
Yeah, sure. Can I take the mic?
Yes, sir.
Thank you so much. Thanks a lot. And at the outset, let me say that it's a pleasure to be here. Honorable moderator, my panelists, and illustrious participants who are present over here. The focus of what I'm going to say in brief is essentially going to be in AI and health, specifically the government health sector perspective. So the pillars have been defined, and let me congratulate, first of all, Karthik on an excellent opening session, the keynote which has set the ball rolling. We are talking about the various pillars, and I'll be talking about more specifically what are the poignant areas, specifically from the AI, health, and government perspective. But when I talk about government perspective, quite a few of these elements will be present in other areas of private sector. Quite a few elements of these will be present, having a universal presence as well. So the first thing is defining data standards. When we talk about data quality and accessibility, a very important element is what should be our data standards. And if I talk from the government experience perspective, then each project is very unique, and at the outset we have to look at to what is the data standard. We should not be looking only from the perspective of the project or a specific project being an end in itself, but it may require a continuation. And if we want to make use of the synergy of research, then what work has been done on a particular project has to be carried forward. And that's why data quality and accessibility is important, but defining data standards becomes extremely important. For example, I'm doing a project on diabetic retinopathy, then what has to be the standards? They has to be defined. And not only the standards as far as the core disease is concerned or the health parameters are concerned, what are going to be the parameters as far as the other accessories, the measuring instruments, and other parameters that would be acceptable as far as implementation of the project is concerned. Data quality is always, extremely important. Interoperability. Standards have to be looked into and quality has to be ensured so that we have an interoperability. And as I said, that research and applications do not become silos in themselves, but they offer a platform where further work can be carried forward. Institutional coordination for data access. Well, now as far as government sector is concerned, how can we coordinate? When I talk about institutions, these institutions are government as well as private sector. Can we cooperate with each other? Like in government, we have an MOU with the Ministry of Health, with Convening AI, which is also present over here, a private sector organization which is providing us the platform. And we have the institutions of excellence, which includes the AIMS Delhi, the PGI Chandigarh, whose representatives are over here, and AIMS Rishikesh, which all the three are coordinating. So institutional coordination. But institutional coordination is also important not just for launching a project, but also for access to data. It's not necessary that one institutions like AIMS Delhi may be having all the data, and why we not have a look at the PGI Chandigarh, or maybe a private sector hospital. Can we enlarge our scope of cooperation? That is the principle that we have to think about. Common data repositories. Now, how do I use data collected over in a particular research so that we have a common data repository? And I said, this will help the research and the application not to be limited to itself. Support system, now extremely important. When we are talking about a project, we are only talking about the IT platform. Yes, it's very important, and that is given. We are talking about the data, extremely important. But when we are talking about the health sector, we also have to be very conscious that the doctors are hard pressed for time. They are the drivers, they are the movers and shakers. And many support systems will be required. One of them can be the human resource. Who's going to enter the data? Huge amount of data has to be entered. AI is not going to enter the data directly. And at the end of it, there is a human being, a data entry operator, for example, who has to take the medical data which is available, who has to feed it into systems which is hungry for data. Regulatory framework was another pillar. I'm briefly touching upon it. When I talk about regulatory framework, again, the issue of standards are going to come. There are going to be regulatory framework which are defining certain standards. Regulatory framework will also take into account to some extent the quality of the data. For example, if I take the DPDP Act, which has come recently, we are talking about fiduciary relationship, we are talking about the anonymity principles, whose responsibility is what. And then in that particular case, when we are defining standards, when we are talking about data quality, we also have to take into account the regulatory framework. For example, we are talking about medical data, we are talking about Aadhaar, then we are talking about Aadhaar also. If you're talking about Aadhaar, then we are talking also about the UIDAI Act in the concept of India. Because there are multiple layers of identity which is built in data. And then we also have to anonymize data. How do we do that? Common data repository support systems, again, they are also a part of our regulatory framework, because if we are talking about data repositories, then we are also talking about sharing of data, whom we can share data with, what is the nature of that data, the principles of confidentiality, they apply. What also extremely becomes very relevant is not only just privacy of data, but also security of data. And this is one area we often tend to overlook when we are lost in the glitz and glamour of AI, that data security is extremely important. What is going to be the standards for data security? The accepted industry standards, is it going to be sufficient? The experts have to think about it. And I always try, coming from a background where I do security audits for other countries, I always try to emphasize that we have to give a thought at the very nascent stage as to, are the standards for data security, cyber security, access controls are sufficient for the health sector? When I talk about financial data, coming from the background of income tax, that data is extremely relevant when it is today. 10 years down the line, when I talk about the banking data, how relevant is the 10-year-old data? It is relevant, but the relevance is decreasing. But when I talk about the health sector, if somebody is able to get 10 years old record of a patient and continuously, is it relevant? Or has the relevance increased? I have to ask that question. And then the issue of data privacy, that becomes relevant. What becomes relevant is, an individual is there. His health record has ramifications for his life, for his insurance, for his work, for his privacy, and not just, as I compared, for his finances, which it has relevance. And therefore, what are going to be the security standards, where before I talk about the issue of sharing of data? Now let me talk about specific government experience in brief, so it sets the ball rolling as to what the government is doing. So as I mentioned earlier, we have developed 3 centers of excellence as far as the work of AI in health is concerned. We have AIMS Delhi, we have the PGI Chandigarh, we have AIMS Rishikesh. We have a tripartite MOU, actually it's between the Ministry of Health and between the Vadvani AI, but that takes into account the various centers of excellence as to what work is being done by them. Now let me give you a look as to what are the various projects which we have already embarked upon. Many of them are in different stages of development. For example, we have the clinical disease support system, which is already integrated with our telemedicine platform, which is called eSanjeevani, which is already helping the various doctors at the field level in making a diagnosis. The media disease surveillance IHI platform, which is helping in crawling through the web and catching hold of the various news about the eruption of the various diseases and developing it into, is there a possibility of outbreak of a particular disease? What should be the alert level? And all those, I'm just giving in brief. Diabetic retinopathy, a very interesting project where, because of damage to the nerves and retinopathy taking place, how we can make use of the images to help the doctors understand as to how much is the progress of the disease. Prediction of adverse TB outcomes or the various lung conditions, cough against TB, line probe assay, dermatology, oral cancer, alcoholic hepatitis, radiology, ASHA, helping the ASHA workers at the ground level. These are some of the various projects which the government has embarked upon. These are at various levels of development. But let me tell you one thing which I feel is extremely important. The work of AI is not just for the purposes of brainstorming. The work of AI is not just for the purposes of development of a proof of concept. The work of AI has to be application oriented, especially for a country like India, especially for the government sector. And the reason being that, look, there are 3 Ds which govern the health sector of India and especially AI. The first D, I would say, is the huge demand. There is a great divide. The divide is across demography, and that divide is, we are very conscious of the fact that the lack of health penetration which we have. The government has made lots of effort, the private sector has come up with its own effort, but still the ratio of the doctors to patient, as we can see in India, is still on the adverse side. And we would like to make use of AI solutions to bridge that divide to the extent possible. The demography. India is a country with huge demography, diverse demography, and that is ideally suited as far as the health sector is concerned. And of course, we have data. Huge data, which we have the advantage of. So, as far as health sector, government sector, India is concerned, I would say we are making the right moves, but we have miles to go. Thank you. Thank you very much.
Thank you, sir, for your enlightening address. Now I would like to hand over the session to Mr. Sameer Kanwar, Director of Digital Health for India and South Asia at PATH, who will be moderating our discussions today. Over to you, sir.
Thanks, Ananda. Thank you so much. I think probably I have a very little role to play now after these 2 presentations, actually, because largely that was the focus area of the entire discussion. So what I'll do is quickly probably just summarize as to what has been covered and just drive the discussions, because as I see we have exactly about 57 minutes, and I'll take 2 of them. So that leaves us with 55. Quickly, we've talked about data, and in data we are looking at the availability, reliability, and the accessibility to data. We are looking at the privacy concerns around data. We are also looking at the overall quality of data. We've said we've got huge amount of data, but we need to look at the quality. We need also to look at the continuum availability of a continuum of data in terms when we look at AI models to be able to use them. And the availability of data in public. All right. So public data sets, I think, is a huge call, and a huge cry which comes from the private sector always. Right. We've talked about regulatory frameworks, and probably also we need to include the validation frameworks, and I'm sure we've got experts in the room who's going to talk about it. How do we validate and who certifies, right, these products? Everybody claims today in the private sector, you know, I have 80% efficiency, I have 90% efficiency. Which is the institution? What is the institutional framework which is available? And Dr. Madhukar talked about the institutional framework in terms of the center of excellences being set up in India, right? Can those be the places where we could look at certifications coming out in terms of who's validating those products which we are talking about, right? What are the data sets which have been used? What are the gold standard data sets available against which the algorithms need to be tested out, right? I mean, because I think largely what we are looking at is there's a huge trust deficit when we look at AI, when we look at the private sector, and when we look at the PPP model, which we keep talking about, private-public partnership. It doesn't happen in the AI world is largely because of the trust issue. How do we, together as the stakeholder community, build that trust around it, right, to be able to work in the same space, right? Because technology is going to come from the private sector. There's absolutely no doubt about it, right? The scale lies in the public health sector. Who and how do we bridge that gap, I think, is what probably we should be looking at when we are looking at Global South. And what Dr. Karthik Adappa mentioned very clearly was, you know, how can we look at the center of gravity, if I may call that, to shift of technology from the north to the south, because that's where the scale is, that's where the requirement is, that also is the place, fortunately, where technology is now coming from, post-COVID. So how can we leverage the sets which are available in India as to be able to lead that discussion going forward globally. Lastly, also, probably one aspect which may need to focus on and part of the discussions is how do we build evidence? Because that's probably in the health sector is a crucial piece which is as of now missing as to how do I build evidence for use of AI, evidence for use of digital health, evidence for use of technology, right? So with this small summary, I'll move to you, Sanjay, because you've got probably the largest amount of experience in this room, if I may say so, in terms of the diagnostic space. And you've been working with global organizations with multiple countries across the globe, and you work right from the strategy down till the implementation level as far as diagnostic devices are concerned. And there's a huge amount which is happening there in terms of building of hardware as well as the softer pieces of algorithms being used on diagnostic devices. Where do you perceive this, these AI-enabled diagnostics, if I may call so, moving forward? What's the scale which is available, and what's the impact which you foresee coming from these devices being implemented? And if you may just spend some time in diversifying into what is going to happen in the private space and what is the applicability in the public space for these. Thank you.
Thanks, Samir, and a very good afternoon to everyone. So yes, I think rapid advancement of artificial intelligence today has the potential to transform access to screening and diagnostic technologies, both in the public and the private sector. And in fact, we're already seeing that AI-based solutions have, the potential to empower individuals to take informed decisions on, where to get tested, how to get tested, and when to get tested. And we saw this, for example, during the pandemic. We started with the PCR-based solutions where everyone was flocking to the labs, and then how the rapid diagnostics or the RAT test, which became available, and finally the self-test becoming available, which sort of gave the individuals, agency over their well-being, that, they have the power to get themselves tested, But then again, I think there were challenges, specifically with how to read those tests, and how to make sure that the data gets transmitted to the likes of Indian Council of Medical Research and the Ministry of Health, so that you're able to sort of, look at it from a surveillance standpoint. And that is where I think AI-enabled apps, which can allow the community healthcare workers as well as, the patients or individuals like us to be able to read those solutions, and in the security of the homes have a lot of potential. Then I think AI-based solutions, we are already seeing that they have a huge potential to sort of enable task shifting. We are seeing this very much in the space of AI CAD, enabled X-rays. There are handheld machines which are now available, and the government of India is, very actively pushing the use of AI. And under the Global Fund C19RM mechanism, there is a whole bunch of handheld X-ray machines which are being procured by the government of India. And they have the potential to actually enable the community healthcare workers to not only screen for tuberculosis, but also for other chronic respiratory diseases in community health settings. And then more importantly, not just screen, but also, the AI-enabled software is also able to provide them with some sort of an interpretation basis which they can either triage, or do some level of diagnosis at that level. Then AI-enabled cough apps. I think Mr. Bhagat spoke about that, and so did Karthik. These again have the potential of enabling triaging at homes, at communities, as well as at the primary healthcare levels. And then talking a little bit about surveillance, the government, for example, is investing a lot. There is a fantastic National Public Health Observatory that has been, built at the ministry, which, I think of last count, if I'm correct, screening for about 36 diseases, both communicable and non-communicable. So I think AI-enabled interoperability solutions today have the power to strengthen surveillance by very rapidly processing, unstructured data, and then enabling the policymakers to make some informed decisions on, let's say, outbreak management or pandemic preparedness, among other things. And I think with over 3/4 of the US FDA's AI/ML medical devices today focused on screening and diagnostic solutions, we feel that there is a lot of innovation that is happening in this space, and this is something which is going to rapidly, keep on increasing. Having said that, it is critical that, in order to fully realize the potential of AI-based solutions, it is critical to ensure the availability of gold standard data sets. And I think Honorable Minister in the inaugural session, he spoke about that the government is going to look at, making these data sets available. So I think that is something which is absolutely critical as we sort of move forward. And it is needed, not just for product development, but also for product evaluation and also for post-deployment monitoring. But there are some impediments, in terms of, these data sets being available. There is obviously, limited guidance on the development and management of these data sets. Then I think Mr. Bhagat, you spoke about, data governance. So I think the governance mechanisms, they need to be strengthened to make sure that the privacy of the individuals is protected, and there are some sort of standards that can be sort of made available. And last but not the least, there is an absence, or I would say inadequate and streamlined regulatory approaches to make sure that these data sets can be used in a responsible manner. So maybe I'll stop there, Samir, but happy to take on more questions.
Thank you so much. I think, wonderful, Sanjay, and that's what probably I was expecting as well, coming from your end. In terms of, I think you raised important points in terms of task shifting and I think use of unstructured data, and probably I'll have a question for Mahir when we come to that, right? You talked about data sensitivity and specificity, I think, in the last convening which we had in June, and probably there's a connect there. We'll talk about it more. And of course, talked about screening at population level, which probably is the public health use case, I think, for all these technologies, and of course, the decision making and the gold standards data and regulatory frameworks, which we are already talking about. I'll shift the focus a bit and coming on to you, Megha, in terms of, you work in a very, very diverse space of brain mapping, right? And I'm sure, I'm not a doctor, so I'm sure, but there would be a requirement of, very specific and contextualized data sets in terms of demographies, in terms of age-related, data available. So what has been your experience globally as well as, let's say, in the global south, in terms of availability of these data sets, and how much of a struggle it has been to be able to, develop and train your algorithms using the existing set of data which you have?
Great. Thanks for the question, Samir. And I'll start contextualizing my answer with a little bit of like a primer on what BrainSight AI does. So in a nutshell, what we're doing is creating Google Maps for the brain. There's very little that's understood, and the intent is to enable clinicians to get a whole brain point of view that improves the ability for better prognosis, better diagnostic capabilities. This in itself as a process, so I'll just focus on what the data requirements are, and then maybe what are some gaps within the system already. At a fundamental level, if I had to say that I had to map everybody's brain, even in this room today, there are maybe 3 parameters that are of absolute crucial importance. The first is at a geographic demographic level called brain atlases. So we have Asian brain atlases, we have Caucasian brain atlases. We also now increasingly have Indian brain atlases, but just the quantum and the availability of that is something that needs to be augmented. So that's also the foundational block for a lot of the studies. The second level is cohort-based. So this is where we get into demography, we get into brain morphology, questions about how does epilepsy, what does an epileptic brain look like? How is it different from the point of view of a normal standardized brain set? And this itself, for us as a startup competing from a global south first point of view, is to say that we actually have the opportunity to build the largest data repositories. And a lot of the intervention here could be about earlier, readier access. So we did speak about PPP models. We did speak about a lot of the interventions that come in here. But from our perspective, a lot of the challenge really lies in terms of creating the right kind of incentives for different players in the ecosystem. There are a lot of front runners in India already that have this data. So clinicians, research first in institutions. Can incentives be aligned better to ensure that data sets for these are actually shared with us at very early stages, and we are also able to then quadruple that advantage many-fold. Lastly, individual data parameters. So even within a cohort, I may have a very, very different morphology because of my clinical history. And sourcing that currently from hospitals, from individual patient sets, there's a lot that comes in terms of standardizing technical parameters from scan-based perspectives. We have spoken about patient privacy, who owns that data, how do we ensure that that remains absolutely sacrosanct across the value chain. So just to kind of summarize it, I would say for us, the question on availability to a great extent would be a joint intervention on how do we create more investment to actually get a lot of India-based data focus going within the brain space. Largely, the atlases themselves do take a lot of intervention to get built, so maybe there can be some concerted efforts there. The second part on access, can there be better incentives that are actually aligning a lot of the stakeholders even within the defined ecosystems that we are looking at and build from there on. I'll stop here, and I'm sure we can kind of come back to this with different perspectives on the table. Thank you so much.
Thanks, Megha. I think this was really educative, actually, if I may say so, at least for me. I had no idea about these kind of data sets and the requirements around it. And probably I do have a sub-question for you as well as other private sector players in the room, and I'll come to that if we have time in the end. Dr. Basant, I'll move on to you very quickly. You've, as the helm of NHA, you've been at the forefront of getting the sectorial DPIs for health up and running in the country, and you are now probably well placed to move into the maintenance mode where you will be probably evolving and taking it forward. From your perspective, having done those building blocks for digital health, where do you think it positions us in terms of very quickly being able to use them for artificial intelligence use, and what is the role which you think these building blocks play when we look at technologies like AI very quickly coming into the public health space as well?
Yeah, thank you, Samir, and I'm very happy to be here. I'll just take a minute to introduce what we are doing at the National Health Authority. The Ayushman Bharat Digital Mission is out to create the national health, digital health ecosystem. And at NHA, we are not only talking about government, we are also talking about the private sector. 50% of India's health records get created in the government sector, and 50% roughly get created in the private sector. Whatever government health programs take away or from the private sector, the laboratories compensate for that in the private sector. So a lot of records are getting created both in government and in the private sector. So why is there just a outcry for data sets from the government? I think there has to be a larger discourse. The responsibility of sharing data sets should not only be with the government, it has to be with the private sector as well. And I think that is one point which I would like to raise very, very early in the discussion. Of course, we are creating the digital public infrastructure. At NHA, we are having the ABHA ID for all the citizens, for the HPR ID and the HFR ID for the doctors and the facilities. And basically we are doing this for creating an environment, an ecosystem where digital health transactions take place. And we feel that the transacting object in these transactions is the electronic health record. So maybe we also need to look at how much of our total volume of health records is actually electronically available. Of course, the digital mission is pushing the whole health ecosystem towards creating more and more electronic health records. So without the electronic health records, the discussion around data sets and interoperable data sets is pretty futile. I think till the time we have these data sets handy, this discussion has to probably factor that in, and we have to ensure that it's a coming together of all the stakeholders into contributing these data sets and using these data sets, as was highlighted by the presentation by Karthik here, around the principles of AI and the involvement of stakeholders during this discussion. At NHA, we are ensuring that our whole approach is citizen-centric, wherein the citizen is in control of his or her health records, and the consent of the citizen is quite central to our architecture. And the recording of this consent during this whole transaction is something that which Samir talked about, creating, having a system where we have evidence of a transaction taking place, of logging these, all these consent artifacts. So that is one point, I think, where the digital mission is trying to address this problem. I think there is a lot to be done on the regulatory part. DPDP Act has probably helped us, getting our basics right, but still, when it comes to privacy, the policies around anonymization, creation of data lakes. All these policies are still under preparation, and at NHA we already are talking about creating a data lake, and we are formulating this policy around anonymization. But I think all of us as stakeholders, as thinkers around AI, as votaries of AI, we need to move quickly around formulating these policies, because without these policies, and their applicability equally to government and private sector. I keep repeating that because somehow I feel that the whole onus of sharing the data sets today seems to be on the government. So I think I'll stop there about the initial part. The government of India very recently has, during its presidency of G20 presidency of India, we went ahead and we had the global DPI repository, which is available online. The Ayushman Bharat Digital Mission in itself is a DPI. We are offering it, to the whole of the world. So I think there needs to be more discussion around it, around the whole need for digital public infrastructure.
Thank you so much, Dr. Vasant, as usual, to the point. And in fact, you snatched one of my questions which I had for the private sector players as to why are we expecting always the government to share the data, and why can't the data available with the private sector also be shared in the public? Probably we'll come to that in the end if we have time. But I think you raised very, very important aspects which probably were a part of Dr. Madhukar's presentation as well, in terms you are creating a continuum, as we understand. With the ABHA, you are looking at making digital footprints in terms of availability of data points, and you talked about interoperability, which comes automatically with these building blocks. Excellent. And then of course, very important point you raised was the human-centered design and the patient being, and that was one of the points we were discussing with Mona also, right? She was mentioning that, consent, when we look at consent, we keep taking consent from the doctor. Nobody talks about the patient whose data actually we are about to share. So great points. Mihir, I'll move on to you being the scientist in the room, and we understand the kind of path-breaking work which, Vadhwani has been doing with the government at one end, and also, building that core infrastructure for digital health as well as AI in India very specifically. And we've seen a lot of your work happening on ground. You've been able to create those use cases, from public health, and being able to moving towards creating at least basic data sets availability with whether, for TB, the Feedly was there. Then you had the anthropometry, research which has been done. And I'm very specifically coming on to, how much of this, when you think, is applicable to the global south, and how much of effort and how much of potential investments start playing up, when you look at creating this kind of an infrastructure, institutional infrastructure, in terms of data sets, in terms of building those algorithms, looking at those use cases. And how much of it you think, and I'm coming to your point which you mentioned last time in June proceedings, that the sensitivity and the specificity vis-a-vis, the coverage aspect of the availability of data, and with the new technologies coming in, where probably we are looking at smaller data sets being used to do larger pieces of work. Where do you think we can go forward from here in terms of spending lesser money, being quick on adoption of technologies, and being able to demonstrate these use cases which you've been working on for so long? Thank you.
Am I audible? Hello?
Yeah,
It's fine. Yeah. Oh. Hello. Is this fine?
Yeah, it's fine.
Okay. Yeah, thanks. Thank you so much for the lovely introduction. So one thing I wanted to mention is that a lot of the technology in machine learning today is developed in the West, and while we as India are interested in building our own models, especially like the larger models, there is a lot of value in using this technology and adopting it to Indian context. Now the question that arises is how do you do that, and how do you even understand whether it's applicable or not, right? So the first step is really to design a really good evaluation of these models for your context. And so what the first step should be is to, for your particular problem, is to create the right evaluation data set and to define the right criteria for evaluation. So in certain settings, you may care about standard like machine learning or statistical metrics such as sensitivity, specificity. In other more open sort of domains such as generative AI, you're interested in evaluating like on a much broader surface area. So for example, do the prompts, do the responses to prompts make sense? Are there hallucinations and so on? So the first step really to like define your evaluation criterion. And this often requires the data collection, data curation. It often requires understanding the problem really deeply, which allows you to really get that in place. And then one thing that we've also noticed in our work is a lot of the times the data sets you try to evaluate on, or the data sets you use in the Indian context, they have varying levels of documentation and like protocol quality. So it's also very important to really have a good protocol defined properly, because especially as machine learning scientists, one thing we want to know is if the model breaks, if it goes wrong, why did it go wrong? And you can't do that unless you understand the data deeply. And to understand the data deeply, you need both a documented protocol and you need to work closely with domain experts such as public health folks, doctors, and so on, to identify what each error means, right? And then when you come to, for example, these modern neural networks, one fantastic way to really use them is to import the neural networks, the base model from which is often high quality open source models, and do what's called fine tuning or domain adaptation, where you sort of tweak the model based on a smaller, high quality curated data set that you've collected to sort of adapt it to your problem of interest. Now here again, what happens is, what we notice is that high quality curated data with a human in the loop often is much better than curating it on like large amounts of data where you actually don't understand the quality. So quality control and documentation again is super important here. So the fine tuning is maybe an algorithmic technique. We also have sort of curation from the public health lens or like from the medical lens, where a domain expert actually helps you curate, helps you understand, oh, this data looks good, but actually there are so and so errors which you might not have sort of realized as a machine learning person. One very interesting example that comes to mind is our work with the ASHA chatbots that we have. So this is a partner to the ASHA worker, the frontline health worker, that helps her answer sort of questions in her day-to-day, curating, sort of pulling answers from multiple documents that define their protocol. So one thing we noticed, so we use both the translation model as well as a generative model. Translation sort of converts their input into English, and the generative model sort of answers the question and then translates back into the local language so the ASHA can understand what's being said. Very simple things. So for example, in a standard translation model, language is more formal. There's a better understanding of what translation looks like. But when you go to sort of the grassroots, the language changes, the dialects change. We noticed that the model was translating ASHA as hope instead of ASHA as ASHA worker. So like small things like this really can break your flow if you're not careful. And so I think at the end of the day, just like understanding how to sort of fine-tune the model for your context really is the key.
Thanks, Mahir. I think that was pretty insightful in terms of from the tech perspective. I'll quickly move on to you, Joe. You work in the domain of mental health, which largely is still a taboo. People don't come out, right? And therefore, probably there's a huge potential for use of technology there, right? So from your perspective, having run a very successful startup in this space, in this niche space, if I may call that, what's been your experience, and how do you think we can make this more accessible and more affordable, as part of public health, as part of also at the ground level, right? How does it work there at that cutting edge, if I may also?
Thank you so much, Samir. Visa is today the world's largest and #1 mental health chatbot. So we've been doing this for 8 years. We started out actually in Aurangabad, Maharashtra, doing rural trials in 300 kilometers around it. And we've sort of finished our journey doing a RCT now and a clinical trial again back there after 8 years. But the journey went from saying we can possibly solve mental health. In 2016, we realized we can possibly solve global mental health with AI. Because people open up to AI much, much faster than a therapist. And even if you can screen people for mental health, there is no therapist coming. So we first used the AI to detect whether somebody was dealing with depression using the movement of their phone. But none of them got any therapist access, only antidepressant medication prescription. What's the point? So if you're going to solve it, we realized, then our journey went to saying, okay, we're going to prove it with our own data. So the data came from 6.5 million users now globally from 95 countries, 1 million of which are in India. But all of that is still a high resource language because you're in English. And with that, you prove, you take your NIH grants. Yes, there is no funding in India, but Indian companies are getting funding internationally and proving their impact. So you get all of these grants, you prove it with NHS, government of Singapore uses it, all of that. But for the last 2 years, especially after the advent of GenAI, we've come back to India. And with Gen AI, we've been able to figure out how to use it safely, privately. Anyway, we figured out anonymity and all of these clinical safety, DCBO 129, all of the NHS standards anyway. So when you come back to India, you have to apply that back in India. But you have to do something else. So that depression anxiety chatbot becomes man ka coach badle soch. So you have to, you have to really co-design it. So everything we do now is a co-design with an NGO that is working with this vulnerable population. And the Gen AI is being co-designed. And you realize when you talked about fairness, it really brought to me that the kind of unfairness we were seeing was, you talked about the way it talks, right? Gen AI will talk because a lot of what written Hindi is in a very written Hindi language. And Hindi is not really a language. All these dialects, they call them, are the real languages. Hindi is only 200 years old. So all of that Braj Bhasha, Bhojpuri, the dialects as they call them, that is how people really speak on the ground, right? Not the way we are taught to read. And that becomes very unfair to a person. So you have a Hindu child and a Muslim child, they're talking very different types of Hindi. And if it is not understanding one or the other, you're being unfair based on that background. So all of our co-design labs are about making sure that when you're talking your man ki bhasha, it has to be really able to understand clinical safety to detect that you're being suicidal at that time. Because the chance that AI is not working can be a life not saved. So it's a lot. Sorry, I'll stop here, but this is our journey.
Thank you for being emotional. I think it was coming out very clearly from your piece, right? And then you, I think, touched upon a very important aspect of, the interconnect between technology and the clinical protocols and setting up those in place and the processes being in place to be able to support the support mechanism which takes on the findings of the technology, right? Thank you so much. I'll quickly, sorry, I'm referring to my notes because we have got a huge panel. 10 of us, so probably it's difficult for me at this age to probably remember everybody. So Ankit, I'm moving on to you. QRI has been in this space probably for the longest duration of time. And you again have worked not only in the private sector, but successfully being able to implement projects in the public domain as well with the governments, right? And you have a huge diverse experience of having probably worked in 100 countries now?
Yeah.
Yeah, great. So from your experience and from your global experience, where do you think that, very specifically in the radiology space, the models which you developed, how much of them are scalable? How much are they cost effective? And where do you think is the space for being able to use them in the public health? Because that's where the scale for your products is, right? So right. Is it affordable by the governments, and how do you make it affordable for the governments to be able to adopt such technologies?
Right. Thanks, Samir. Talking about our experience, we have been sort of able to deploy these models in over 100 countries, over 2,000 sites. And coming to the generalizability aspect of this, right? What we have seen is that, taking an example from Dr. Karthik, right, gender inequality, for example, what we saw was that for a particular disease, if the same amount of men and women have that disease, lesser fraction of women will reach hospitals and even lesser fraction will reach an X-ray room. So that bias is there in the data when you are training the algorithm. So one of the findings that we had on TV was that the algorithm was getting confused by the breast shadow on the chest X-ray. And we have been working with on foundation models in some years, and we have reached a stage where we can instruct the algorithm to generate a chest X-ray with a nodule of a 45-year-old woman and compensate for that lack of data through generative AI. So the technology can, get biased because of the biases in the society, but the same technology can also be used to tackle those challenges, right? Similarly, what we have seen in lung cancer, for example, right? In the global north, a nodule on a chest X-ray can mean lung cancer, but in the global south, a lot of these nodules get confused as tuberculosis, and a lot of patients who are actually diagnosed, who are actually having lung cancer, are misdiagnosed as TB patients and are on that treatment for years before the situation becomes really bad. So again, there are multiple such subtleties that we have learned with our experience on over 100 countries, and we have been able to bake those subtleties into the algorithm today. Taking another example, the regulatory point that Mr. Bhagat touched upon, right? When I go to a US or a UK, the first question they will ask is, these hospitals will ask is whether it is FDA cleared or not. I don't think anybody is asking that question on ground in India. So yes, we need to have regulatory bodies. For example, like, I mean, it should be, you can only use algorithms which are cleared by CDSCO or evaluated by ICMR, but we have not seen that question coming from on ground. So there is a lot of awareness that also needs to be taken in. We have been working on, what we have seen is that in countries like India and Southeast Asia, the surveillance model has been very, very successful. In fact, we ran projects with the government of India in some pilot sites in Baran, Rajasthan, a couple of districts in UP, and with BMC in Mumbai. And we were able to show that 25% more TB patients are detected if you run AI on a surveillance mode, not in TB screening programs, right? So basically patient is coming for cough or pneumonia, and he or she has signs of TB, which will be detected 1 year later. By that time, the situation will worsen for him or her, and I mean, it will also like sort of communicate to a wider section of the society. So those pilots had been successful, and what we were hoping for is that now we can actually scale that model across all districts of India, and our estimate is that we can detect at least 500,000 more TB patients annually if we run AI on a surveillance mode. So those are some of the learnings that we have had. And about scalability and security, obviously we have to have regulatory bodies, but institutionally as ourselves as well, we have implemented some techniques where like a certain % of our scans that are being read by our algorithms on a daily basis would be reread by radiologists, right? So that we are able to capture model drift, because the model remains the same, the data might be changing, right? So, and whenever we see like sort of some drift happening, I mean, we will retrain our algorithm, or we will try to really go deeper into what is the issue with that data. So, yeah, those are some of the learnings that we have had, and happy to elaborate more, but yeah.
Thank you so much. Thanks so much. Dr. Mona, I'll move on to you. You are the sitting on the hot seat, I think, because we've been talking about regulatory frameworks and ethics, and you've been working in this space for quite some time. So just wanted to quickly ask you, where do you think we are, and what do you think is lined up for us when we look at, Ankit mentioned about, let's say the FDA and a parallel of FDA, or let's say the European AI Act which has come in. Are we looking at something like that coming up in India? And can we be looking at focusing on a global south and looking at probably more of a validation and a regulatory framework which can be used by other countries going forward, because it's a huge investment which happens at the institutional level to be able to bring these up, right? And second, attached to that was, how evolutionary do you think this needs to be, because technology is changing extremely fast. Within 6 months, 8 months, we are looking at new technologies coming up. How evolutionary do you think this should be, and are we working towards that or not?
Let me just get back to you on, since I've been on the ethics committee, and we have learned a lot working with Anurag. We were probably the first group that had actually validated the diabetic retinopathy private models and successfully implemented in Punjab in one of the aspirational districts. It was a landmark study. So coming from that background, what we realized as we were going forward, we have no regulatory network. Health being a state subject, it is up to the states how it goes. So there was a huge gap when we started and how we implemented and what was the result. So I'll just split it into 2 parts. One is the regulatory, since the research is still in the nascent stage, ethics has come into focus only now. Ethics is the last word we actually had when we were in the medical college or when you're in the technology field. Ethics was the last word. It is only when you have used the word responsible AI that now there's a huge push towards ethics. So there's no research in ethics, and we are still at the baseline. So at this point, your regulatory framework has to be adaptable. Since it is such a turning rapid pace, and a lot of AI startups are already there, it has to be adaptable, and going forward, based on our evidence that we are getting, those need to be modulated. We cannot take whatever is acceptable in the global north, that is not going to be applicable in global south. It has to be adapted to our settings. So that is where India can take the lead. And I think NHA is one of the most, I think it is really positioned quite well, considering it has actually laid the baseline where you already have the EHRs and all these interoperable methods are already there. So that is one good thing I feel that India has done in the last, and it can be taken at scale. Second, I will now come to the ethics committees, which are actually, you can say they are the, where we are coming at the academic. I'll talk at the academic, health systems, and the public awareness. At the academic level, we have the ethics committees. So the general ethics committees have no idea about how to take on. Sitting on the ethics committee, I have been on the ethics committee at PG, I have been on the ethics committee at the IT. We need interoperability. Ethics committees at medical colleges will need data scientists and legal experts with tech. So those need to be defined at this level. You cannot have general ethics committees. You will need to have specific, like we had stem cell committees. You will need specific subcommittees on AI ethics who are going to do it. And you will, since we are going to be working with health systems a lot, you will need government policy makers. In the health systems, again, you will need a continued program, because many of these problems are people at the government level do not really understand. There's a huge push toward, at the digital level, but people who are going to be implementing it need that continuing program. They need to understand what is the procurement process. Suppose a company comes to me when I'm sitting in the seat. Do you have the sensitivity and specificity? I think your AI actually said about validation. That is exactly what we did when we validated these DR platforms. We actually looked at, we said, okay, you give us your sensitivity and specificity, we will validate it in the real-time settings. And the biggest flaw was they had tested most of their models in tertiary care settings. They were not ready for the public health settings. So that was the second. Last is public awareness. You'd go, you will get the consent. We are too simple. We don't even understand data. So you need to have this, I think, since the generation next is actually so, they know what data is, but people who are in the rural settings, they don't know what data. They are so simple. They will say, oh, it's a machine. They have that lab thing in mind. Acha, lab say, aisa hai. The lab will say, give it, and they'll be very happy with that. But they really do not understand what is data security. So we will have to run data security, data campaigns at the level, national level, so that they are aware what they are signing for, how their data is going to be used. So these are the three contexts when we say regulatory is separate, but at the level of the ethics who are going to be the applicants, we need innovation hubs, validation centers, and it has to be housed in academic institutions and centers, and a separate department of medical ethics needs to be created with a specific AI ethics and this thing where you have policy, data science, to be together. And unless until that is developed, we will still be struggling across how do we implement it. And of course, a validation mechanism has to be developed. So having said that, I think that is where we need to focus now. Thank you.
Thank you so much, Dr. Mona. I think clearly, I think we got a lot of work to do there in that space, and probably that could be one of the inputs which we can probably take back to the GPAI forum, right, in terms of the institutional framework which you said needs to probably be set up first, and then we can look at the actual frameworks in terms of evaluation and validations, right? So probably setting up that rightly, and I think that's what even Dr. Karthik mentioned when he talked about the AI playbook and the AI life cycle. That's a huge piece in that, and then probably we need to solve this puzzle as we go forward if we are looking at scale coming in. Anurag, I'll move on to you. I can't see you, sorry. Okay, thank you. You are in the process of setting up probably the most state-of-the-art setup in India, right? And having had the privilege of see it coming up, it's very exciting. So from your perspective, as you are setting it up, what are you looking in terms of the next generation of innovations and technologies coming up? And very specifically, looking at the community and the public health focused technologies.
Thank you very much, Sameer. One of the pleasures of going last is that you have got wonderful points from previous speakers to build on, and sometimes wonderful lines like Joe said, "Man ka coach badle soch," and the fact that there is no one language, and these are real challenges. And I'll start by my answer by pointing out that people who need to do surveys for even companies like Flipkart realize the answer in India to a survey can be ghanta. And ghanta is not a recognized word in any particular thing, but if you want to use AI, you have to do it. So what is the challenge when you look at state-of-art systems today available that you can do it? There are two directions to this. The first part is the huge data piece that I think Dr. Garg, Dr. Dapa both spoke about. Until you have electronic health records, you are not going to really move forward. And this is something both public and private will do. But here comes the next part. Even if you had electronic health records, how will you extract the data? One entire major direction of work for us is an extraction of such data, because the reality of India is all the note that regarding all the medication will be in the other note section. It won't be on the drop down of the drugs. And this is something I know from previous experience in 2012, where we deployed e-health centers with Hewlett Packard in a shipping container, everything on the cloud. We hit 5 million people. We went to Bangladesh, we went to Bhutan, World Bank, Philippines. But when we look at the data, it was very trivial, right? A few diseases and symptomatic care pretty much took care of 90% of things. So one is, given electronic health records even at scale, how would you meaningfully extract data? And we find that current generation large language models aren't ready. But the brilliant part of it is that open source deployable tunable models have now been given. I think as a community, we must be very clear that if we want to do things for India, we want to do things in a setting that are useful to all, these have to be models that we tune and train on our data, our contexts, which means we start with them. And I will not name companies. I don't want to promote any single company, but the open source world, even in the domain of, let's actually call them large multimodal models, because language is just one part of it, that is what excites me. And the other brilliant part is that everything is so fresh and young, that young kids playing with this have as much a chance to do well as people with great experience in computer science. And last time I looked, if there was one thing India had plenty of, was young and trusted, enthusiastic kids. So to me, it's not about Ashoka, it's not about my center. If we come up with a symptom solving on one side, what Basant talked about, the electronic health data issue where both sectors participate, and creating a pool of people who are willing to use multimodal data. And I find Indian companies are very willing. Recently, a company called Goki is opening up their APIs on our campus for young people to play with. So this is the experiments India must run, always keeping the core of GPAI responsibility. And one last word, very important, along with Mona said. New England Journal never opened another specialty journal in all these years. Finally, it opened the NEGM AI. I think the departments India will need are departments of medical AI. And it won't be run by physicians alone, that's critical. And the other thing about consent, it is never consent, it is informed consent. Where is the information? In fact, who has the time to give information? But language models following playbooks and scripts can actually provide information, engaging the deepest of people whose data we take. So very long answer, but I hope that was useful.
Wonderful. I think it was very encouraging, actually. Thank you so much for that. And by the way, you were not the last speaker. We still have Gitanjali in the room. So moving over to you, Gitanjali, because you come from a diagnostic background, represent the private sector, have worked quite a bit and quite long in this field. So from your perspective, very specifically, what role do you think private sector can play when we look at demonstrating success in public sector? And again, alluding to the question what Dr. Basant actually said, why are we always looking at data coming from the government, and what role do you think the private sector can play in terms of making this data available for larger use?
Sure. So I'll try to keep it brief. So the problem statement, we worked for the past 8 years into antimicrobial resistance. You know that judicious prescription of antibiotics is not followed, and it's a very difficult problem to solve. And the niche area that we have chosen is wound care. And it's, in India at least, there's very little knowledge. There are different schools of thoughts. And antimicrobial resistance is a very big problem. You need to target UTI, urinary tract infection, blood sepsis, issues related to wound care, and that's what we focus. And over the past 8 years, what we realized was, being a single company, we have a technology that can detect bacteria, fungus without even taking a sample. So we use photonics plus AI, which is a core strength. And we've been called in many of these international photonic conferences to give presentations in the patents and what we have developed, but then it requires huge amount of money if we have to apply the same technology in other application areas. So only focusing on wound care, maybe I can throw some challenges that we face, and it can be adopted across. We are currently licensing our technology for developed countries because we understood that it's a very difficult play if I have to go to global south. It's a very difficult challenge. You need to come with incentives like how Megha told. It has to be very attractive for the Indian community to adopt both in the private policy level, and it's a big challenge with lot amount of money that is required. Now in US it's very simple because you have insurance providers, you need data, diagnostic tools are used, preventive tools are used, they look at the data, then only they prescribe, let's say, antibiotics or even advanced therapeutic solutions. So the first part of it in India, what we realized is there is no money in prevention and diagnostics. It's a very hard pill to swallow. I'm so happy that GPAI was able to do it because they've partnered with, AstraZeneca was one of a very good strategic partner, but not everybody is blessed with that. So we now have come with a very good solution where we have a preventive model where you can screen at the point of care at home. We have a diagnostic solution which is a core IP, and we have also combined with many of the therapeutic players so that when you approach a patient at their site, you can give starting from understanding how early are they to develop a wound. If they developed a wound, what has happened to the wound, whether there's an infection, whether there's a lot of blood flow, and if there is a loss of blood flow, what are the therapies that they can do there itself. And you know that all this requires a lot of data. Now this is where I'm coming to. Again, there's a lot of challenges in private players sharing the data because in US the same kind of solution, the BARDA has given $100 million grant, and the company was just doing research for the past 10 years. They're happy to share the data, and it's predominantly on wound care, which is for burns and traumatic wounds and how the wound healing journey has gone. But in India, you're severely constrained. And if I have to approach and tap into investor community, what sets us apart is the proprietary images we have. So as a private player, we are very much happy to share the data, provided the government on a policy level understands this is a huge issue. Startups are addressing it. Let's please support them. I'm not telling give all the $100 million. Support in different milestones. Let us prove to you that we can bring in the impact and the change that the community needs. And we're happy to do it, taking it forward. And one last point, if I can add, again, if India has to develop our own regulatory pathway around this, we are already spending millions of dollars, looking at EU MDR, looking at FDA, looking at the cyber security and other aspects of it that they're doing. If we can adopt something that's on the similar lines, we can save funds as well, and we can develop something that's more robust and that can cater to the global, South as well, not just India. I hope I answered.
Thank you so much, Gitanjali. I think you made us feel your pain. Everybody felt your pain in the room. Thank you for that. I think we are quickly coming to a close of the discussions, and I'll quickly move probably to the experts. I think, and I realize that all three of you sitting here probably have about 70 years of experience between. I'm not looking at the age, and I don't want to predict that, but I think more than 70 years of. I was talking about the overall experience, and I'll move on to quickly to you, Dr. Madhukar. You've heard the panelists, right? And we've heard the private sector perspective, and we've also heard the government, and we've talked about the regulatory framework, which you were talking about, interoperability. Any last summing points from your end? How do you think we should be looking at tackling all these three issues which we talked about going forward?
So tackling the three issues. Tackling the three issues is easier said than done, frankly. When we talk about the, and I won't say that work has not been done, a lot of work has been done. If I talk about the issue of data availability, data accessibility, data standards, then NHA is doing wonderful work. And if that is to be implemented as and when it gets implemented, it will be creating a wonderful ecosystem as far as data is concerned. First of all, we have to understand that. As far as the issue of regulations are concerned, there is a common understanding and a common belief that yes, we read a regulation. And the regulation and the regulatory framework is not just in one dimension. Something has to be in IT, something has to be in medical sciences, and something has to be as an overlap between them. Eventually, it's the bodies and the organizations which have to be seeing who has to do what. And it's not just one person's baby, not one organization's responsibility. As far as the third element is concerned, that I understand that India will be a great platform for the launch of AI in health. And that is because of the inherent requirement and the core strength which India has. And if we see that what are our health goals is firstly is availability of healthcare, second is affordability, and third is accessibility. And if I talk about integration of AI in different elements of technology, for example, if I take telemedicine and AI, which we have put together, then it addresses all the concerns. And it helps India to attain those goals. And as I've already spoken, that we have the huge data sets which we are there to tap. But again, the steps are already there which we are discussing. We have young people who understand technology. We have technology which is available, but then again we have to adopt it from the Western context to the Indian context. So these are some of the areas which is going to help. And last but not least, ethics has to be a part of a regulation also. That I feel eventually. So that's what I can add as a, as a summation of what I feel.
Thank you so much. Dr. Basant, moving on to you, any last comments you feel, how do we go forward from here?
Yeah, thank you. I think I'll just invert the argument which I started with, that it is equally the responsibility of private sector, because it is very important to invert the argument. I think AI is a very good use case for forcing the private sector to join interoperability, right? So it's not that I'm not a naysayer. It's just that I wanted everybody to think about it. But I think AI is a very good use case, wherein and government of India has already taken a lead in digitizing, in adopting the APDM interoperability standards, and I think it will force the rest of the ecosystem to follow and join it. I think one more thing which I think I would like to really mention is that today the digital mission is only creating the basic infra. It is for the private sector to innovate and to use that infra to bring out more value-added applications, services, and I think that is where I was very happy to hear what Ankit and Gitanjali were talking about. Government does not aim to do everything by itself. We are really looking forward to all the people in the private sector to innovate. I think there is a case for how we support the early movers of AI so as to strengthen the whole ecosystem. Thank you.
Thanks, Dr. Basant. And I think I stand in testimony to what you said in terms of probably you are the shining example in India of having set the technical sandbox, which is being now used by the private sector to validate. And that's exactly what we are looking at being replicated in the AI. And I agree with Dr. Mona that probably you are the institution which would be taking a lead on trying to replicate that for the entire technology space. But we can leave that for another day in terms of discussion. Moving on to you, Dr. Karthik, what are your key takeaways and what do you think can we pass on as an informed, thinking from this group back to the GPAI forum going forward?
Firstly, thank you all so much. I think this has been a very learning experience for us. At GPAI, we've been essentially trying to get a variety of stakeholders. I think we've also felt there is a need for more stakeholders. So that's the first one. I just want to kind of leave with three broad thoughts. First, taking on what Anurag talked about, the concept of open source, standards-based, digital solutions that we've done. Can India lead the path from the global south in coming out with these open source AI solutions? I think that's something which has been one of the key takeaways that I've had. Second is, of course, is on the fact that, I kind of, when I looked around the group, I mean, we now have a variety of stakeholders coming in, but what about our education and our capacity building? The fact that we need interdisciplinary education. I'm actually really fortunate that I'm a physician by training, but actually got trained as a data scientist in the US. So that's one of the reasons why I didn't talk about anything in AI, because I've not done any AI research in the South. So most of my research is in the global North. But so what we really see here is a very vertical, siloed education system. So whether you go to medical school, an IIT, or an engineering school, I think the good part about AI is it's not just for a physician or an engineer, it's also for a social scientist. There's also space for an anthropologist. So essentially, AI is one space wherein not just the private sector and the government, but also people from around a variety of stakeholders can come in, and most importantly, the civil society, citizens who have an extremely important voice to play. So I think therefore what I feel is, I think as GPAI, and especially for the organizers, we're extremely happy that we're able to capture a very diverse arguments, diverse perspectives. And I think essentially what we want to do is, in terms of our next steps, think about creating this playbook on how do we capture all these perspectives in a typical AI life cycle. And I really want to thank all the participants, participants as well who've been a part of this interesting conversation. I think we may not have time to listen to your questions, but we have the experts here, so please feel free to have great conversations. Thank you, Samir, for great moderation as well. Thank you all so much.
Thank you, Dr. Karthik. And before we leave the room, I know you had quite a few questions in the audience, and we also had a couple of them, but unfortunately because of the paucity of time, and like Dr. Karthik mentioned, I think we can socially engage after this. But before we leave the room, I just want to put a vote of thanks for Ananta and her team. Ananta, can we have you? Yeah, okay. Thank you. Thank you so much for organizing this. It's a huge effort, I'm sure, getting all of us with the different sets of times and organizations, and thank you so much for organizing this for us. Thank you.
Thank you, Mr. Kanwar, and thank you to all our esteemed speakers and panelists for your invaluable contributions. Your insights and experiences are crucial in shaping the future of AI in global health and will greatly contribute to the platform of the Global Partnership on AI. It is through gatherings like these that the unique perspectives and challenges of the Global South are captured and represented at an international level, ensuring that our collective efforts are inclusive and impactful. I would now like to invite Mr. Rajneesh Kumar, CEO, Director, Capacity Building and Finance, NEGD, Digital India, to kindly felicitate our esteemed speakers. Please join me in thanking Dr. Karthik Adappa. Sir, please. Dr. Karthik Adappa, Regional Advisor for Digital Health, WHO. Dr. Basant Garg, Additional CEO at the National Health Authority.
Sir, wait. Still not happy. Thank you.
Dr. Basant Garg, Additional CEO at the National Health Authority. Shri Madhukar Bhagat, JS, Ministry of Health and Family Welfare.
Thank you so much.
Mr. Sameer Kanwar, Director of Digital Health, India and South Asia, PATH. Ms. Jo Agarwal, Co-founder and CEO of WISA. Mr. Mihir Kulkarni, ML scientist at Vadvani AI. Ms. Megha Chaudhary, advisor at Brainsight AI. Dr. Anurag Agarwal, head of the Koita Center for Digital Health at Ashoka University. Dr. Mona Duggal, assistant professor at PGI Chandigarh.
Website updation required.
Dr. Sanjay Sareen, Vice President of Access at Find.
Do you have a card? Okay.
Mr. Ankit Modi, head of products and founding member at Cure AI. Ms. Gitanjali Radhakrishnan, founder, CEO, and MD of Aduvio Diagnostics.
Okay. Can I take your number? Yeah, 981. 845 1946. Drop me a message. Oh, we're already there on the chat group.
Oh, yes, we are.
Yes, we are.
Thank you, everyone. I request all speakers to kindly stay back for 5 minutes so that the social media team can interview you. Thank you.
See if I have a card.
Yeah, that's what we usually have. Thank you so much. So we'll be in touch and I'll get the health ministry to liaise.
Sure. Very nice stars. NIG we met last time.
I'm an AI regulatory person from Europe. I work with Government of Ireland, and we were discussing AI issues with large health data sets. And there is an interesting parallel. So there are 27 EU member states, each has a different language, each has a different health provider. Therefore, the patient data has different ontology in each state. So we are unable to exchange data to make a large data warehouse. Do you see that kind of issue with different states? Like each state has its own health industry, they have their own
places for people to sit. Chairs.
Good afternoon, everyone. We're going to be starting in just a couple of minutes. But maybe just to start, can I please request all of the speakers on this panel to please come up on stage. We're taking a group photograph. I've been informed by Meeti that a copy of this photograph will be handed over to you at the end of this session. So.
Where should we see? To move the chairs? Oh. Chair in the back. Thanks. I don't know why.
A very good afternoon to all of you. It is a great pleasure and excitement that I welcome you all for this important session focusing on India's infrastructure readiness for AI. Today, we all have gathered here to lay the groundwork for India's ambitious goal in AI and ensuring that infrastructure development aligns with national priorities of innovation, self-reliance, and inclusive growth. Let me introduce our distinguished panelists for this session who will guide us through this enlightening journey of exploration and discovery. Our first panelist is Mr. Thomas Zakaria, Senior Vice President, AMD, Colonel A.K. Nath, Executive Director, CDAC, Mr. Vishal Dhupar, MD, Asia South, NVIDIA, Mr. Sambit Sahu, Senior Vice President, Kritrim Ola, Mr. Anil Nanduri, Vice President, Intel, Mr. Hriday Vikram, Senior Vice President, NetWeb Technologies, Mr. Rohini Srivatsa, CTO, Microsoft India and South Asia, Mr. Ranganath Sadashiv, CTO, HB Enterprises, Mr. Gaurav Agarwal, Vice President, AI, Reliance Jio, Mr. Sunil Gupta, Co-founder, MD and CEO, Yota Data Services, Mr. Tanuj Bhojwani, Head People Plus AI, and the man with the most difficult job for this star-studded panel, Mr. Amlan Mohante from Carnegie, India. Now, I would like to request, as you all are aware, the India AI mission has been approved by Government of India in March 2024 with the vision to make AI in India and make AI work for India. It aims to make India a global leader in AI and to develop technological self-reliance of India in the field of artificial intelligence. With the vision of Global India AI Summit, is being organized to focus on the key pillars of the AI ecosystem, which are also highlighted in the India AI mission, that is compute capacity, foundational models, datasets, application development initiatives, future skills, startup financing, and safe and trusted AI. The India AI compute pillar of the mission aims to build a high-end scalable AI computing ecosystem for catering the increasing demands from India's rapidly expanding AI startups and research ecosystem. The AI compute infrastructure of 10,000 plus GPUs will be built through PPP, public-private partnership, to strengthen the AI ecosystem of the country. Further, an AI marketplace will also be built to offer AI as a service and pre-trained models to AI innovators, which will act as a one-stop solutions to resources critical for AI innovation. MIT has undertaken two-pronged implementation approach for setting up compute infrastructure in the country. As already mentioned, MIT will be setting up 10,000 GPUs through the PPP model, but the building of this enormous AI infrastructure will take some time. Till that time, MIT will be providing subsidized compute services to researchers and innovators by empanelment of compute services provider. MIT will be inviting expression of interest from existing compute service providers for empanelment. Talking about this session, India's infrastructure readiness for AI, the proposed panel discussion will aim to address the key issues around readiness of AI infrastructure in India. Now I would like Mr. Amlan Mohante, the moderator for this session, to take this session forward. Thank you.
Thank you, Anuj, and good afternoon, everyone. I hope you all had a very good lunch and are settled in nicely for, I think, what promises to be a very engaging session, a very different session, I think, from what we've seen already over the course of the morning. We are here today to discuss, as Anuj said, the present and future of India's AI infrastructure. I think we're going to be covering two specific aspects of this. One, to take stock of where we are today in terms of India's infrastructure for AI, and two, really present a roadmap to make India future ready for what's coming on AI. As you all know, there are many dimensions to thinking about compute and AI infrastructure. There's the economic angle to it, there's a political angle to it, a technological angle to it, environmental, geopolitical, and we'll try and do justice to each of these issues over the course of our 60 minutes we have here today. But I think we're going to be focusing primarily on four big issues. The first is around strategy around investment and PPP, right? The public-private partnership model. We really want to talk about, what types of investment strategies are most likely to benefit India's strategic interests in the long term. We also want to talk about how the government and the private sector can collaborate to make the goals of the India AI mission a success. The second big theme is around sovereign AI. One of the goals of building India's AI infrastructure is to make India self-sufficient. But do we really have a clear conception of what we mean by sovereign AI? So that's something we'd like to explore in this panel. The third is around access and affordability. As you all know, we're here as part of the GPAI Summit, and a key goal of the GPAI, as we saw in the September declaration, is to make AI accessible, democratic, inclusive, and sustainable. So what we really want to do is try and understand, in the Indian context, what the problems around access are, and maybe perhaps propose some solutions for how we can make AI both accessible and affordable. The fourth and final theme we'll touch on is about people. It's about who's going to be building this infrastructure, what kind of skills we need to be able to build this out, and where that's going to come from. With that, I'm here to kind of open up this panel. Maybe some quick house rules just before we go. To start with, can I please request the organizers, can we please have the doors at the back closed? There's a lot of background noise. But for the speakers, I am absolutely delighted to have all of you here, and the organizers at MIT for making this happen. we have everybody from across the AI stack represented here, right? Industry stalwarts, senior government officials, people engaging with people on the ground who are actually building and using AI. So it's my absolute delight to have all of you here, and also the challenge of trying to ensure in 60 minutes I get all of you to be able to share your insights. My name is Amlan. I'm a non-resident research fellow at Carnegie India. Our goal is to produce independent research and analysis on issues of AI policy, and that's what we're trying to do here today. It's not just a roundtable discussion that we're broadcasting. We're trying to actually create some actionable insights that we want to feed in to the government strategy on compute. There's a lot of people in this room, so if I can please request all of the speakers, keep your remarks to about 90 seconds each. I can come back to you, right, for a second round of interventions, but I really want to get everyone into this discussion so we can make it inclusive, interesting, but most importantly, useful for the audience that we have here today. Right. So to kick things off, I'd like to invite Thomas Zakaria to share a 10-minute keynote address to kick things off before we get into our roundtable discussion. Thomas, over to you.
Thank you, Amlan. Good afternoon, all of you. It's such a pleasure to be here, to be part of this discussion. And I would be remiss if I don't take this opportunity to congratulate the government of India in launching this really remarkable initiative. And having been part of similar initiatives in the US during my career, I would also be remiss if I don't acknowledge the tremendous amount of work that has been done to prepare this initiative. I know it requires lots of meetings, consensus building, and ultimately to launch an initiative that is so significant. So congratulations to all of you in the Secretariat who has made this initiative possible. Now I'm going to take my 10 minutes to try to frame the discussion from my vantage point of view. And my vantage point of view is having spent 35 years of my career in the US at a US government lab. And actually 3 decades of deploying and building leading edge frontier computers. So that sort of dates me, but the first supercomputer that I was responsible for, which was ranked #1 in the world at the time, was an Intel Paragon XPS 150. There were 2 copies, one at Sandia National Lab and one at Oak Ridge National Lab. Let me put this in context. If you have an iPhone 6 or better, you have the power of that computer in your hand. And to me, that is what is fascinating about the current decade or the current moment that we are living in, is because you have the power of a supercomputer in your hand with which you interact with a cloud or a GPU infrastructure that is now can be conversational and get information back to you fairly quickly in ways that can dramatically change the direction of how we live, work, play, and interact with each other. And there, I think India has an advantage because the penetration of mobile phones in this country and the data that you have, particularly at the edge, gives India a tremendous advantage. So I'm not going to, well, maybe this will work. So I'm not going to go through all 3 decades of my experience having deployed about a dozen or more of supercomputers, but I will just focus on the last 4. The 4 that you're seeing in the background are 4 systems that when they debuted at #1 in the world. Now, that has its own merits, but the reason why that is important is that that means that when we were deploying, we really did not know how it's going to work. I've always said that the machines, I've never deployed a system that I promised. I've always deployed something that is better. Because typically it takes about a 4-year design build cycle. And today, at the rate at which GPUs and CPUs are coming to the market, we have almost an annual cadence. That means you have 4 generations away when you are trying to build these infrastructure. So as India thinks about building the infrastructure, that is something that you want to keep in mind. The second thing that is really interesting about this chart is that it was in 2007, Los Alamos National Laboratory had just deployed Roadrunner, which was the first system that broke the petascale barrier. And so we had a series of workshops at Oak Ridge, Argonne, and Berkeley, where we invited the best minds in the field from all over the world to come and talk about deploying an exascale system. And the conclusion was that it cannot be done. Why? Because the best estimate at the time was that it will take 1 gigawatt of power to run an exascale system, which was not going to be something that the government was going to support. I don't know the price in India, but it cannot be that much different. But in the US, a megawatt is roughly $1 million a year, so 1 gigawatt of power is $1 billion for just the utility, electric bill, to run a computer, which was not in the cards. So we put as a design goal that we are going to deploy an exascale system in 2018. Why? Because it rhymed with 10 to the 18. And with a power budget of roughly around 20 megawatts. And the best estimate, if you were to squeeze out every known innovations that we had at our fingertips, we thought we could get it at 140. 140 megawatts sounded a lot better than 1 gigawatt. And I can tell you I almost got fired because everybody said that this is crazy. So I will just skip to Titan. And when it came to Titan, what happened was that the Dennard scaling just, this is when you get kneecapped. We had decided on a multi-core processor, which just was taken out of the roadmap because it was found to be too power hungry. So we had committed to building a machine for which we had no processor. People were just beginning to dabble with GPUs. GPUs were a gaming processor, did not have, remember in the scientific world, you wanted to be repeatable, reliable results. So which meant 64-bit arithmetic and error-correcting memory. That was not in the cards. There was this tiny little company compared to today. It was about a $3 billion market cap. And the CEO of that company, you might have heard of him. His name was Jensen Huang. And he came to Oak Ridge, and over dinner at a restaurant called Bistro by the Tracks, we decided that he could take out enough of the graphics engine from the die to put in 64-bit math. And the reason why I tell that story is that don't assume that the roadmap is predetermined. There are going to be changes in the way. And so we deployed for the first system at scale, which had 18,000 GPUs and 18,000 CPUs. Now we talk about 10,000 GPUs. This is back in 2012. We deployed 18,688 GPUs that had 64-bit error-correcting memory. Summit came next, and then ultimately Frontier. And Frontier was really interesting because what you see in the bottom is government investment. It is not just purchasing GPUs and CPUs. Government invested, in all these systems in non-recoverable engineering dollars to get the machines built. And then through programs called Fast Forward, and we invested in driving the innovations in the chip. And so, for example, what you're seeing is 3D stacking technologies, chiplets, memory, etc., that allowed us to deploy the exascale system Frontier with, as you see, it at 29 megawatts for 1.2 exaflop of performance. 2.5 years later, it is still the #1 system. So that tells you we were pushing the envelope and driving. And so I think that India's aspiration should be not only driving the ecosystem, but also impacting the roadmap, because it'll have a global impact. What you do here will change the course of how things are done globally. Now, this is another thing. So if you go back and look at when we deployed the Titan, which is the first instantiation of large GPUs, it suddenly changed the framework. Now, Google started thinking about TPUs in 2015. They deployed TPUs in about 15 months with the development cycle. What you're seeing is really the number of publications. You see that there is a hockey stick kind of change. So the availability of this infrastructure changed the trajectory of the imagination of people in terms of what could be done, and that is what that graph is pointing to. And that's going to happen here, and you should be prepared for that. This is a framework. This was discussed in the morning. I'm not going to go too much further, but I think India's strength is data. I think models and applications. You have a very large pool of talented folks, and this sort of tailoring the infrastructure. I think it is probably not realistic to go in the frontier scale infrastructure. 10,000 GPUs. It's plenty enough to develop, to create a developer ecosystem. My message here is that my 30-year experience tells you that there's going to be an insatiable appetite for compute cycles. And so you should be planning for the next instantiation and the next instantiation, because that is what is going to drive the true innovation ecosystem that you can expect in India. So why do I say, what to expect? So these are real numbers. So if you're looking at the number of parameter counts, or the size of models that you're trying to build, the frontier, so you see that exponential curve. What you see is 1 trillion parameters in the outer edge, which is comparable to ChatGPT-4 and sort of frontier models. That run, if you want to make, I use 6 rupees and 90 cents a kilowatt hour. That translates to $250,000 per one training run. So at the frontier scale, this is pretty expensive business. But you don't need to be there to develop the ecosystem. What you see is that in the billion, 10 billion, $100 billion range, you're going to do remarkable things, particularly for the use cases and solution space. And that is really where you're going to have the vibrant ecosystem. By the way, inference is also, as you scale the number of queries coming in, you see that the power demands are going to be extremely impressive. And so that is another thing that you should be thinking about as you build. I have built 3 data centers, each with about 60 to 70 megawatts of capacity. The last one, we spent $100 million retrofitting in order to prepare for frontier, because it was completely different technology in that currently that data center operates at a PUE of 1.03, one of the most efficient data centers that is available. And so there are things that you can do which you should be thinking about right now. You can also do, I think this is again playing to India's strengths. There are lots of algorithm improvements that you can make in order to develop models that takes into advantage low precision calculations. For AI models and frameworks, you don't need the 64-bit. In fact, there's a publication that has just come out that says that we can actually do it without any matrix multiplication. So don't restrict yourselves to what has been done to date. Use this as an opportunity to open up the aperture to innovate from India for the rest of the world, and of course, for India. And this is, to me, one of my pet slides, because when I think about AI infrastructure, I use AI infrastructures as analogy to the electric infrastructure, right? Ultimately, the people who will be using a mobile phone to engage with this infrastructure, with use cases and application, they don't want to know. When you flip the switch at your home, you want your lights to go on, your blenders to work, or refrigerator to work. They don't care which turbines are running to deliver the cycles. They don't care which GPUs or CPUs are behind the thing. What you want is to think about, here is the edge whether it is smart retail or in smart city or commercial enterprises. So having this kind of an ecosystem model allows you to innovate at scale and develop new products and really have a tangible impact on public good, economic, and national security. So I think of the pervasive AI as a best opportunity to really impact daily lives of billions of people. I mean, I don't know which, I happen to know somebody who was working on the cancer. Cancer is a reportable disease. It's something that clearly people are concerned about. India has a scale. Preventing cancer is better than treating cancer. And so projects like Karkinos and others that are going on in India is ideal. Automotive, and traffic flow, traffic control, sensors, industrial optimization. But also don't restrict your thinking about AI to the data center. There's going to be AI on your desktop. There's going to be low power, low latency AI at the edge. And those are the kinds of applications that is going to have a huge impact. So thinking of it as a connected, integrated ecosystem, I think, is really important. So I think this is my last slide. I think that if you think about the AI mission, I truly believe that the ambition is at the right scale. I think you have the plans for skilling and talent development, which is significantly important. I had a chance to interact with the senior members of the Secretariat today. And the public policy framework that you've laid out, I think, is really, really top-notch. I think it's going to have a huge impact. Thinking about how to make this ecosystem available to the entrepreneurs, to incubate new companies, et cetera, is something that you ought to think about. The investments, both the government investment, but the multiplier. I truly take, I'm sure that success has thousand fathers or owners or what have you. But in my small way, I would say that what we did at Oak Ridge in driving the GPU accelerated computing by government investment is why we are here today talking about AI, because of the data and the ability to process the data using GPUs at scale. And I think that this initiative is going to give you that opportunity. Engaging private sector to co-invest and amplify government investment, because government investment de-risks private capital so that private sector will invest in trying to build out this. And then, of course, don't forget investing in R&D and building the ecosystem. So congratulations. I wish I was in a different phase. I see a lot of young faces here. This is really an exciting time. I can look back over the last 3 decades, and there was not one moment that I regret. The only regret that I have is that I wish I could do this for another 3 decades. So I'll close with what Ray Kurzweil recently said, that modern technology, particularly medicine, today for every year of chronological year that you age, you get 4 months back because of improvements in medicine. He believes that with AI, that's going to be 5, 6, 7. Now, what I don't believe is that he thinks that the day will come when for every year you're going to grow younger, so maybe you'll become a baby. That is something that I would like to see. So thank you very much.
Thank you, Thomas, for setting the stage for the panel discussion we're now going to get into. Thomas, from what you said, the thing that really struck me, one, is that you said India's ambitions on compute are in the right place. So I think that's something that we should really start with, right? Trying to define what that ambition is and how we're going to be able to realize that ambition. The second thing I think you said that was really interesting was that the choices that India makes is going to have global impact. And no better place to be making that statement than this Global IndiaAI Summit. So definitely want to get into the technological choices that India is going to be making in deploying its compute infrastructure. You mentioned Ray Kurzweil, and I was just listening to a TED talk that he published today, where he was talking about how every prediction he made about the singularity, people rubbished him and they were skeptical about him. And you said the same thing happened to you. And that's precisely what I'm going to make all of you here do today, which is try and predict and recommend choices for India's approach to compute infrastructure, right? So the first question really we want to talk about is how should India be investing across the compute stack to be able to realize that ambition? And what is that ambition? I would say from what we've heard today and other discussions is to make India the AI innovation, intelligence, and use case capital of the world. I think everybody in this room can agree that that's something we can get behind. What we want to discuss here today is how we can make that happen. And so there are many ways we can think about infrastructure. We can think about the production of compute in terms of different activities around manufacturing, assembling, packaging, and so on. We can think about different levels of that compute stack, starting with chips to software that's running that chip, to optimizing, to data centers, to cloud servers, and so on. So really we want to ask, if India is looking to deploy 4,000 crores over the next few years into compute, how should India approach that? I'll obviously want to get all of you into that discussion, but Vishal, maybe if I can start with you, right? Really starting at the bottom of the stack, but you often talk about thinking about this as a platform. India has been talking about investing 4,000 crores in the acquisition of 10,000 GPUs, right? Talk us through what the next few stages of that should look like, right? Clearly, we heard from Thomas, we're going to have an insatiable appetite for compute. 10,000 GPUs isn't going to cut it. So firstly, how should we be deploying those 4,000 crores and acquiring those GPUs? Is GPUs the only place that we should be investing? And what should the next 3 to 5 years of that journey look like? And sorry, and you also only have 2 minutes.
Does this work? All right, great. I think, Thomas, you set it up really well. I know when you used to come into Indian Institute of Science and talk about the Oak Ridge relationship, it was talking about one workload at any given time. We've crossed paths long time back, and the world has changed. We are at an era of intelligence, and India is at the era of intelligence. And I think the part that we're discussing today is one of the three things, at least in this talk, which is the compute part of it. There are 2 other parts to it. And you did touch, Thomas, about the algorithm. And we are upon this universal approximator upon us, which can be applied to everything, not just the language, but to anything which has a meaning. Be it biology, physics, even robotics articulation, steering articulation, proteins. We can apply and learn from there. And you said, Alam, that the best thing to do is to be the capital of intelligence. So compute is important. I'm sure there are a billion people here. They'll tell you about compute. But what about our own know-how, the method? This is a rich country, culturally very rich. Our common sense is very different. Our sensibilities are very different. The way we need to take this digitization process that has been taking place, how do we codify that so that we don't lose out? Just like how Paris is the fashion capital, Milan is the fashion capital, India needs to be the intelligence capital. And if we think from that perspective, that know-how needs to be codified. And that's where we need to start. And if we codify that, the algorithm is known, compute you know how to source, there's a better opportunity for us to really make India the intelligence capital. It serves what you all said, build in India, for India, export from India, move your back office structure to the office of the world, be the capital. I think we should commence from there.
Thanks, Vishal. Invest in know-how. Anil, I'm going to come to you next. I think what Thomas and Vishal are also alluding to is investing in R&D, right? The ability to understand how these things are built, that know-how, code that in some way. So obviously Intel has a lot of R&D investments in India. How are you thinking about how this capital should be invested by the government over the next few years?
Thank you, and it's a great honor to be here, and it's this esteemed crowd here. As regards to, in terms of kind of looking at breaking barriers to the software developers and the software ecosystem, the talent is amazing here, right? What you need to do and what needs to be done is, how do you break that access to computing for AI development democratized and broadly available? So if you kind of look back in history, right, there was the telecom world where we had the landlines and the penetration of landlines, and then the mobile era came in, and the wireless and the spectrum. If you kind of think about how you basically India stepped a computational generation by not needing landlines, and you could break the communication, barriers by having cell phones and the penetration of cell phones, got you connected to the internet. When you think of AI computing in that space, it's going to be breaking that communication barrier, the language barrier, the education barrier, because what generative AI is going to be doing is make human speak, human understanding, human interactions much more democratized, right? And that codifying everything that's said is great, but to fast track this is where the computational access is fundamental. And now if you look at the innovations that are happening, I think you look at, everyone's familiar with Llama. Llama is a model that started with Llama 2, and there were 70 billion parameters. Guess what? Llama 3, 7 billion parameters is as good as a Llama 2, 70 billion parameters. So there's so much of innovation in the algorithmic side that is going on. But those innovations are not possible if you don't have the computational playground to bring those ideas to life, right? And so when you look at 10,000 GPUs, right, I think there's two questions, right? What is the outcome that you need to be striving for? If you're trying to look at is this build in India with your unique data, unique culture, and if you can break the cost models in India, rest assured it's exportable anywhere in the world. Today, the whole AI ecosystem is you're importing models from the Western world and trying to leverage it in the domestic world. So it's more an application model. So what the infrastructure is going to be looking to do is apply what has already been built. To create new innovation, I think what Thomas was highlighting is how do you be a catalyst, and how do you create the investments needed to actually enable algorithmic level work in AI?
Thanks, Anil. I think what you said also about using this compute to apply it to specific problems, build models, increasing computational efficiency, I think is something that we should also factor in how India looks at building out its compute infrastructure. So I'd like to go to folks in this room who are actually building some of these models. So Sambit and Gaurav, if I can come to you, right? Really trying to break this down into numbers, right? Really the question I think on a lot of people's mind is how much compute does India really need, right? The Indian government seems to think 10,000 GPUs for now, right? But we also see other pillars of the India AI mission about building a large language model. And we were hearing earlier in the conversation in the morning about how much compute that actually takes, right? A few thousand GPUs perhaps to train these models, several petaflops. So can you, as folks building these models, give us a sense of how many GPUs it will actually take to build these models in your estimate, and therefore how much more compute should India be preparing to acquire and build?
Yeah, thank you for the opportunity. I think if you look at really how OpenAI is building GPT-4, it takes around 25,000 GPUs for 3 months. I mean, to train a trillion parameter model, that's the kind of scope you need. That's the kind of compute you need. But as we all discussed, the trillion parameter model is just one type of model. There are other types of models, the mixture of experts where you break it down into smaller problems, smaller models. So I think that's the ceiling, I would say, for the trillion parameter. The second thing is not just the amount of GPU you need, really what's the cost of GPU, okay? If you can design GPUs at a much lower cost, then obviously you can afford a lot more GPUs. And I think that's where I feel there's an opportunity in India to really see how we build those GPUs. There is huge talent here. 20% of the overall semiconductor task force is in India. So how we build those GPUs and how we don't pay the huge margins that the Western world charges us. And so while you utilize the GPUs that is available to us today, but I think in parallel, we have to see really how do we build those GPUs at a much lower rate, at much lower cost. And and how do we scale it up? And the second piece of it is really AI is not just a GPUs. It's also, I think Thomas alluded to, is really also how you propagate AI, different form factors, different ways like smartphone AI or AI PCs, AR, VR. There are many ways we can propagate AI. So I think building the chips ourselves at a much lower cost and having different form factors, and also looking at variety of models, just not only a trillion parameter model.
Thanks, Amit. Gaurav?
Yeah. So I think the question is not about how many. Clearly, 10,000 is minuscule, actually. We are not thinking about a startup. We are thinking about a country, right? And country where, at least the smaller companies, smaller enterprises, startups don't have access to that much of patient capital. If that was there, we don't need any government support, actually. But that's the reality of India, right? If you want smaller enterprises to innovate in AI, they need that support because our VCs are not doing that, right? So I think the one thing that Anuj mentioned, and I was a little disappointed with that it is going to take time. I mean, 10,000 GPUs, if government of India decides to get them, Vishal is sitting here, get them tomorrow. I mean, what's holding us back? Seriously. It's not.
He's sitting next to you, not me. Like high on your right.
So yeah, it's already there. So I mean, if government wants to create that ecosystem, just get them. Get as many as you want. Why delay? Like, let's not optimize too much. Yes, will it create wastage because we will not be optimal? Yes. But if we want to create innovation in a scarcity mindset, good luck with that. It doesn't work. While someone talked about the algorithmic innovation, yes, it will happen. But look at all the top conferences in theoretical computer science. They don't need any GPUs. It's all mathematical, pen and paper stuff, whiteboard stuff. Do we publish more papers in theoretical computer science from India than the Western world? No, it's all the ecosystem. All these things happen with each other. It's not just the GPU, but the presence of enough compute. It creates that energy, it creates that vibrancy to do all of it together. So I hope we understand the speed of essence, and we don't create plans for Bangalore roads. We take so much time that by the time they get built, I mean, they are insufficient and they don't work anymore.
Yeah, fair point, Gaurav. Hear you on the urgency, and one of the things we have heard in some discussions is that perhaps, and maybe this is a chicken and egg situation, they're looking for a business model, right? You're looking for the markets to exist before you can actually acquire and deploy these CPUs, and that's perhaps where I want to take this conversation now. So really, this is a question about making sure this entire investment strategy around compute is commercially viable, right? So I'd like to bring some of you again into this conversation, but maybe we could start with you, Sunil. I think we shall put you on the spot, saying you already hold these GPUs, you can offer them to the government. So talk me through, how a company like yours is thinking about ROI, right? Return on investment. Is it purely in financial terms, as it may be? And perhaps, we should be thinking about other types of ROI as well. And the government perhaps should be investing quickly because there's an ROI in terms of social impact, right? So let's start with you. Tell us what are the economics of acquiring, deploying these GPUs, and why the government already hasn't acquired 10,000 GPUs and deployed it already.
Sure, Amlan, thank you. Yes, I think we all can understand this is a chicken and egg story, that India should have a market, India should have a lot of use cases of developing LLMs or a whole lot of SLMs and inferencing use cases, and once that market is there, who will consume GPUs, and then somebody like me will put GPUs and invest into GPUs so that I can have a return. The reverse is also true. The LLMs will be made in India, or the AI ecosystem will be developed in India only when the GPUs are in India, because right now it's either not available or it's available into some few free credits, and after that it becomes very, very costly. It's not available in India also, sovereignty concerns also come in. Somewhere one of us had to break the chain and take a call that if this technology is big in US, it is big in Europe, it is big in so many countries already developing benefits. India, which has got 1.4 billion people, it is much more digitally enabled compared to rest of the world. All the use cases are into our mobile. If we are consuming all other use cases of technology, why we will not be using AI? If that belief we have as Indians in our digital adoption, it is same going to be case for AI as well. So essentially that chain had to be broken, and that is what the call we took, that yes, we will invest. Instead of being into a scarce situation of 1 node, 2 node, 4 node, can I go for 16,000 node? By the way, that is the size of the order which I placed, which I'm deploying right now. Now, you can say, okay, if there's no customer, what we'll do? But what somewhere I read and discussed with Matty also, that our mission is not only from India for India. Our mission is also from India for India and for the world as well. If we are a software and services exporter, largest in the world, why we cannot be AI infrastructure and platform exporter also? So today, from my first phase, which I have gone live with just in the last few days, 70% of my consumption has been taken by global operators. But from people from US are coming and subscribing to my GPUs, and people from Europe are subscribing, 30% from India. Now, this is something which is giving me payback, so I'm not getting into losses. Second point, while GPU is a costly thing, and I think considering the scarcity in the world, obviously there'll be a cost which might not come down for a reasonable period of time, but I was doing some maths. If I take a 5-year cost of deploying GPUs, 60% is GPUs, the InfiniBand and all the paraphernalia, the CapEx part, but 40% of the cost actually is data center, power, internet, cybersecurity, and everything which goes around that. In India, and by the way, I'm not taking the cost of the platform layer on the top of that, which is completely skill set, which is India's forte. So if I am able to, which in India, I'm able to reduce my cost of OpEx, which is significantly I can reduce. India is a, from data center point of view, we build much, cost-effective data centers, and my skill set cost also is much lesser. It means I can still have my GPU services per hour rate much lesser in rest of the world, and again, that is what we have been able to do. Many people are talking that maybe it's a marketing gimmick, we are trying to show a low-cost center, but it is a price which is competitive compared to the rest of the world, and it is still giving me enough returns. So in India, it is possible to give the world-class product. It is available in abundance, and we can still have a very, very good ROI from India.
Thanks, Sunil. Interesting insight on this global market for compute. Tanuj, can I come to you? You've been studying compute usage in India, right, by startups. This is what the government really wants to do, get compute into the hands of people building, solving problems for India. What does your research or survey, your analysis tell you? Is there a market in India for existing compute? Do we need more compute, or are we just going to be acquiring these chips to sell them outside?
No, I think I want to just bring in small amount of nuance here, which is that India will need more and more compute, as Thomas predicted, as Vishal was saying. Like Sunil is saying, this is a chicken and egg problem. If I knew there was enough of it available, I can rent it and build something on it. Like Gaurav is saying, I will go and do it, right? Our developers will do that. The question that I think that we should ask ourselves in this occasion is, what is the government policy? What is the Indian government going to do about chips and AI? Which is where I have certain sort of, just fundamental nuances. So if Sunil is going and getting on a lot of these 4,000 GPUs, if it's 30% now, by the time the next batch of your 4,000 comes in, hopefully it's 50%, and then hopefully it goes locally. And that's a very smart way of doing it, right? The government should also be thinking in that way, right? If you have 4,000 crores to spend, right? How do I spend the first 1,000 crores to prove that this is helping the cases which are white spaces, right? Where, say, a Sunil's prices will never be affordable. Like, say, research in ISC. So we, use cases you were asking me, startups. I think startups are aplenty. A lot of them are serving international sort of SaaS stuff out of here. So like, it's impossible to summarize the use case. I think where I'm seeing starvation the most is that computational methods applying to research. Lots of research fields, as that paper of AI mentioned across fields from Thomas's lab is very true. We're now starting to see drug discoveries to everything where people are just like, first let's do a computational scan of the whole search space, figure out some viable solutions, and then go experiment on those solutions only. And this is from biology, medicines, everywhere. This is the place where I see a shortage. So if the government is to do something, or if it's something like, I agree with Gaurav, do it now, then you do it for these spaces. That would be my thing. Why can't you do it now? I just want to answer that question, and it comes down to government procurement. If you've not had to deal with it.
We'll come to procurement. But thanks, Tanuj. Good point. Do it now, but also experiment, demonstrate value, and then that will inform the next few stages. Thomas, I want to come to you. You've heard a lot of people and maybe provide some comments at the end of it. But before I can do that, Colonel Singh, from a government perspective, right? Obviously, tracking and monitoring existing compute usage is going to be really important to inform policy, right? Acquisition of GPUs can only be informed by how current usage is. So how is CDAC thinking about, obviously, monitoring compute usage? What insights have you gathered already? And again, if you want to answer this question of how government should be thinking about increasing compute capacity over the next few years.
Is about the monitoring I mean, it's a fairly simple job. You have enough tools available, and you got to invest resources in doing that round the clock, and getting back to the users where you find that non-optimal use of compute has been made. That's a very simple equation that there may be money to buy compute worth, or rather maybe 100 cores. But then if 100 cores are not available, then what use it is? So we have devised ways. CDAC is having maybe knowing that we are having India's, as of now, probably the biggest, I'm not talking about the hyperscalers, but whatever discrete machine we have, it's ranking, it ranked in 23 as a top 75 in top 500. It's Param Siddhi AI, which is 82 nodes and based on the NVIDIA A100. And so we have devised ways and means to keep monitoring and keep hand-holding the people who actually come in and use our compute. And we keep advising them. So this kind of a capacity has to be built up. That is one point I want to make, is about the capacity building. We are also starting, or rather we have courses. We are doing postgraduate courses of 6 months, in which we have courses of HPC system administration, HPC in AI, and we are doing NASCOM Prime courses. So we have made a start, but it has to be done on a much bigger scale, so that when people understand how to do the system administration, how to actually see mix and match between the software and the hardware, where something is going wrong, where your weights are not being tuned properly, or where your software is suboptimal, by seeing the blips in the graph where the percentage CPU or GPU utilization has gone down, memory utilization gone down, how to correct it. So those are the things which need to be corrected, and need to be corrected soon, so that it's a costly affair, and we need to do that exceedingly fast. And one more thing we would like to bring about, the second part of the question you asked, is about the compute itself. So a lot of people have expressed their opinion about deploying more and more compute. I would like to caution here that we should also start thinking, and a start has been made, a small start has been made, given the kind of policy consistency which exists in India today, and the ecosystem which exists in India today, of thinking of setting up design and fabrication facilities for compute, building compute in India, and thinking about a time when it would, today you may be a generation behind in technology when you actually come into the market, but a start has to be made, and you have to be consistent and aim for that time when it makes economic sense to produce the latest technology here and export it. Under the National Supercomputing Mission, we have already made our mark there. We have come up with indigenous servers called Rudra, based on the Intel series of CPUs. It has 2 GPUs, and we have brought it into the market. We have 3 technology partners, and we have now we are thinking of the next 2 generations, which will be carrying more GPUs, which will have faster interconnect between the GPUs, and which will be GPU agnostic. It can take on all the 3 kinds of families of GPUs which will be available. So even these kind of initiatives probably we have to think about.
Sure. Thank you, Colonel Singh. Thomas, anything that we're, sorry, Nath, anything that we're missing in this first, before we move to the second theme on sovereignty, I just wanted to get your thoughts on the larger question of investment strategies and private government collaboration.
Well, I think, can you hear? Yes. So first of all, I want to thank the panel. I mean, all of you have brought out really important points, and so they're all apropos. I think at the same time, I would say, having been in this business for a long time, this is not about allocation of money, resources, but I've always thought about 30%. We are talking about the 30% of the equation, which is the infrastructure. I always think that there's a people game. 70% of success is about people. how do you align the incentives for people to commit their career, their ambitions, aspirations. And I think as you structure this ecosystem, it is really important to not just restrict yourself. The second thing is that GPU is just an easy way of talking about the infrastructure, right? Let me tell you, Frontier, when we were building, every computer at scale, I've always said that if you look at the fit rate, you can mathematically work out and prove that this system should never work, right? 65 million components. The failure rate of, if you look at a SKU, the failure rate would say it'll never run. So these are very, very difficult things to operate in a resilient, reliable way for private sector and entrepreneurial community to thrive, because they have to have these resources available to them predictably, reliably. And so I think it's also important to build not just in the algorithm or use cases, but the talent that is needed to run the infrastructure to keep it running and keep it going is very, very, very important. And then Tanuj, bureaucracy is bureaucracy everywhere. And and I don't mean in a negative sense. So you have to also incentivize and align the incentives there. So making the regulatory framework appropriate for the ambition for this initiative is important. And what I mean by that is that there is going to be, generally there is a reticence to deal with failure, particularly when you are using public funding. And so you have to balance the risk reward and failure success metrics such that people can go beyond and not take conservative approach, but really push the envelope in trying to develop and deploy. I think that's very important.
Thanks, Thomas. We will definitely get into, I think, the larger policy framework that's going to help make all of this happen. But we're fast running out of time. This has been really interesting already, but I do want to move tracks to, I think, another elephant in the room, if I can call it, is this question of sovereignty, right? In Anuj's presentation, he spoke very clearly about this goal of ensuring that India is self-sufficient when it comes to its AI infrastructure. I've had many conversations about this. I don't think anybody fully understands what sovereignty means in the context of India's AI infrastructure. So I'm going to give everyone here a challenge, which is if we can, in this room today, try and at least shape the outlines of what sovereign AI infrastructure for India looks like, that would be a good outcome, right? There are many ways to think about sovereignty, of course. We can think about control and supervision. We can think about autonomy. We can think about economic growth and independence. We can think about enforcement of regulation. We can think about resilience, right? These are all different elements of sovereignty. I'm just wondering whether in this room we can all agree on what the elements of India's sovereign AI infrastructure should look like, and perhaps this could be different in different countries, and we should get into that as well. But again, Vishal, if I can start with you. I know you've been talking a lot about what sovereign AI means. Can you share a little bit about what this means or should mean in the Indian context?
So there are three ingredients from a sovereign perspective, and all three of them exist in India. Firstly, the skill sets. Everybody's spoken about the skill sets. We do it for ourselves. We do it for Globe even more. So we know how our technology people can be applied under the hood. Second is that we've got this massive, massive manpower. Citizens, 1.4 billion, but only 1% of them use computers. Because you have to speak to the computer in the computer language. And they can't afford that. And they do not know how to do it. But today, you can speak to the computer and teach the computer, so we can bring the computer to them. It could be over the mobile phone. So for the first time, the democracy of computing is upon us, where all 1.4 billion people will have access to computing, and that exists here. The third is our own digital experience, which is already in play. As we talk, as we embed, as we capture, that domain experience is here. We have to bring these three elements together on the infrastructure discussion that we are doing. And then we are ready for sovereignty. everything else that you spoke about, policy, regulation, safety, security, of course has to come in. Even the cars did it in 1920. The cars is not the safest thing if you just leave them loose. You have regulations. That's why we are so safe on the roads. So that is a part that we can discuss later, but these three components exist here. Most importantly, the intelligence has to be built by Indian companies in India, and these will be built in AI factories in India, just like Sunil's company's done it, and that's the first glimpse.
Interesting, Vishal. Rohini, can I come to you on this question, right? You obviously at Microsoft operate in different jurisdictions. There are different conceptions of sovereignty around the world. I'm seeing more and more an emphasis on sovereignty in national AI strategies. The UK's compute infrastructure is all about, compute for national security. The US is using trade laws and export controls to increase its own geopolitical positions. Given that you operate in different markets, how should India be thinking about sovereignty? And is AI sovereignty this single thing, or does it have other elements relating to, for example, data sovereignty and things like that?
Yeah, thanks very much. So I think the term sovereignty is a complex one. I think you brought it out a little bit in the initial comments. I would like to at least break it down between two axes. Axes of control and of innovation. And the axis of innovation, I would have additional points around economic value, around ability to grow, provide opportunities for the demographic dividend we have in the country. I think what people are realizing is that and globally, whether it is countries like Korea, whether it is the G42 partnership that Microsoft has done in the Middle East, whether it is Singapore, what countries are realizing is that the pace at which AI innovation is happening, there is a very important element of not just value, but time to value. And what that means is, if you are able to ensure that you are creating, using not just the GPUs, and we've been kind of talking about GPUs all the time, at the end of the day, AI infrastructure requires not just GPUs, but networks and memory. In fact, the networking that the Microsoft infrastructure that is used to train, by the way, if you know OpenAI models are trained on Microsoft infrastructure. So the latest model is also getting trained on Azure infrastructure, and we are building a supercomputer for the next level of infrastructure. So the networking that is used to connect these chips can go around the planet Earth multiple times around. Okay, so we have to really realize that it's not just the chips. I began my career in semiconductor industry, so I will not underplay the importance of chips, but once you realize it has to be a systems view. Having said that, I think the importance to realize that it really does take the full stack, and not just the infrastructure. When I say infrastructure, I mean compute, memory, networking. The power hungriness of these require different ways of thinking about power management. We talked a little bit about in the earlier panel about the kind of power hungriness these chips have, and there's a lot of innovation happening in that. Then to drive value from them is the entire software stack, which is the algorithms, which is the orchestration layer, the software, the ability to manage these GPUs. So what we are seeing is the point of sovereignty, if one defines very clearly that do you want to create economic value in this period of AI, when the country has demographic dividend for a limited period of time, how will we do that, especially in sectors where you have to invest in the people capital? How can we do that? Particularly, I'm thinking of education and healthcare. Can we do that in a way that allows that economic value to come across while keeping the elements of how much you want to control and what is the level you want to build in India? We have had a discussion around how much R&D happens in India. Yes, R&D is changing. Tanuj talked about the fact. R&D fundamentally is changing with AI, and not just by exploring models, but also how simulations are done. So all of that has to happen while we say we're going to wait for some kind of a compute infrastructure to be built up. The train has moved on.
Sure. Thanks, Rohini. Ranganath, I'd like to get your thoughts on this idea that, sure, we want to create economic value in India, right? But again, one of those goals is to ensure self-sufficiency across that entire supply chain. right? To ensure that, as Vishal was saying, that this is actually built in India. So I'm just wondering, is there a relationship between the Make in India program and what we're trying to achieve with the IndiaAI mission, right? India's semiconductor mission also talks about ensuring that these are built, assembled, packaged in India. So do you see a link between making in India and this larger goal of sovereignty under the IndiaAI mission? Hriday, Ranganath, for both of you.
Yeah, there is obviously a linkage. And if you were to look at sovereignty, it's a definition that can mean anything to anybody in that context, right? And with a technology like artificial intelligence, which is so pervasive and perhaps exists between the edge and the cloud across everything, and also so very foundational, right? In the way that you would see everything across the globe be impacted by AI. Sovereignty gets defined there, and it's very organizational, it's very data relevant, it's very country relevant, and there is definitions for that. But if you were to look at artificial intelligence itself, it's a journey, and in that context, building sovereignty can mean like what we are doing today, making servers and other constituents of the entire infrastructure parts there. But I would again go back to the fact that Rohini was mentioning, it's all about an outcome and delivering this as an ecosystem, right? While we spoke of a lot of constituents that make up an AI infrastructure, your ability to run with that infrastructure and make it work for you, like Thomas also mentioned, right? It took him 4 years to kind of put everything to work. And it basically impacts time to market. If you had the ability to rightly put across so many options today, right? Whether it's a model stack, the compute stack, or whether it's the data stack, how do you basically ascertain the right stack that really fits into your business and break that, get that to the market as quickly as possible becomes a very, very important criteria. That's where I feel it's important, like we speak with everything else, our ability to walk the talk with respective organizations, right, in terms of their own needs. And it could be by definition of what does sovereignty mean, or it could be by definition what your AI strategy means. So it needs to be a comprehensive outlook. And if you take AI, it is a technology that's going to get every constituent together, right? I think it's a unifying force from a technology standpoint. So how do you leverage that becomes important.
Yeah.
So Amlan, what I see that this is something which is quite interconnected. I would say sovereignty on one hand, Make in India, and IndiaAI. These three things are pretty much interconnected. I can make you travel through the journey of how Make in India started in 2017 when the program was launched by DIPP and guidelines was launched. And after that, nodal ministries were asked to come out with their, product-centric guidelines for production of products in India and manufacturing guidelines and all. That's how the process of Make in India started. And during this time, I think the best part is that, sovereignty as a subject has emerged like anything. And there is a, reason for it, because this has emerged as a response to data management issues or concerns. Because when you say that data sovereignty, compliance, and digital autonomy, these three things I feel like are the primary concerns which are required to be addressed when you are trying to build the IndiaAI cloud, right? And I think the very basic step is that you opt for the hardware which is produced in India, the components which are traceable, which are used during the manufacturing process. You have got the complete chain of information available with you throughout the process of manufacturing to taking into AI cloud, and thereafter using and building the cloud stack over it. So what I find is that this is the time that you can harness the power of Make in India and achieve sovereignty of the highest order or of the highest degree. That's how I think this should be looked at.
Yeah. Thanks, Hriday.
Yeah.
From what I'm gathering, it seems like what we want to do when we're saying sovereign AI infrastructure for India is to ensure that ideally these are built in India, but definitely under the control, as Rohini was saying, of the Indian sovereign and for the benefit of India. And this makes me wonder whether sovereign AI, based on where we are today is not so much a destination but a journey, and we're in early stages of this journey. So Gaurav, if I can come to you, right? The one thing that I think we haven't heard someone say on this table today is that India should build its own foundation model to be able to be considered sovereign AI, right? Maybe Vishal alluded to it, but I want to ask you very pointedly whether that's a critical ingredient for us to be considered sovereign as having sovereign AI infrastructure, because I was listening to the panel earlier today and they said, I mean, how is India going to use Western models without any cultural alignment and say that we actually have sovereign AI infrastructure?
Yeah, thanks, Amlan. So I think there is like, when you think of sovereign, right, I think, so I'll park the question for foundation model. I think it is an outcome of the discussion. I think why do we need sovereign? Obviously, we care about our citizens, even if the models are hosted outside by big tech, Western big tech. I mean, government has a responsibility to take care of its citizens, how they must be used. I mean, the DPDP Act that came last year is somewhat about that. Data usage, how the citizens' data is used, how financial data cannot be processed outside India. We already have examples of that. So that is the like the left extreme of the spectrum. Then on the right side, we want to lead the world in AI. So if you want to do that, it is much beyond just taking care of your citizens, but you want to lead the world, right? So that is the whole continuum. We are somewhere in the middle right now, where we are talking about at least building our own applications, our own wrappers, maybe contextualized for Indian interest. And I think the foundation models is somewhere beyond this and before leading the world. I think there is no way we can be a AI nation in true sense, like unless we believe we are okay being AI market, which I hope we are not. I think we have to build. There is no other question, as simple as that.
Okay, thanks, Gaurav. Sambit, Anil, where are we in this journey of ensuring that the chips that we use in India's AI infrastructure are built, designed, manufactured, packaged, assembled, and used in India? Start with you, maybe Anil?
So I think we got to break this down, right? I think there's AI is, I think everybody alluded here, there's a sense of urgency. And when you think of that, and we talk about sovereignty, we talk about self-reliance and everything else, how do you phase it, right? So AI is about systems play, right? So first step is that data sovereignty is the kind of the way to think about it is, where is the data generated? Where is the data generating the intelligence? Okay, if you think about models as an ingestion of intelligence, models get intelligent by the data it sources, the data it's used to train. And if the data resides here and the model is sitting outside the country, so just think about it, you're exporting your intelligence. Okay, just first principles, right? Then you have your system sovereignty. If you don't have systems available in India, right, you don't have systems that are actually hosting this data, so you're not going to be able to move this data inside your own country. So that's the sense of urgency that is to be created, is how do I first manage the data I'm generating here, which is, by the way, probably about 20% of the world's data is generated here, right? And how much of it is actually processed and computed here, right, is the way to think about it. And that answers the questions on how models are going to get generated, whether it's a large foundational model or a frontier model or a small model. The ability to create models is just an outcome, right? And then you get that model sovereignty as we talked about. And then you have the balance of trade from exporting applications versus importing applications. So you got to kind of think in that context. And when you come to chips and make in India, build in India, is all about call it a supply chain sovereignty, right? You want to have supply chain resilience. So if you think in that systems view and say, you know what are the steps that I need to do to protect the capabilities that I want in the country? You got to start from, hey, first, can I keep my data here? Can I have my systems here? Can I have my models here? Can I have my applications built here? And then the cost optimizations of chips. Even in chips now it's packaging. You don't need to actually build the chip itself. You get IP and then you can create your own custom silicon. So there are so many other steps. Making sure you have a standards-based open ecosystem so you can have different vendors participate. So that part of it is going to take time.
Yeah. Thanks, Anil. I like this idea of a systems view of sovereignty. Samit, same question, but I'm going to add a little bit of a twist as well, which is, we sometimes think that it's we're moving towards sovereignty if an Indian company is doing this. So when we come to chips, right, for example, I know they're not represented here in the room, but Tata is investing in designing and building chips in India, but that's in partnership with PSMC, right? So this idea that, we will only be sovereign if an Indian company and only an Indian company is doing that, is that even realistic, right? So I don't know if you're happy to talk a little bit about your efforts to be building chips in India and whether that's in partnership with foreign companies and what that means for sovereignty, but also more broadly this idea of, why we're approaching sovereignty, how can we achieve that?
Yeah, actually 20 years back when I started my journey in India, there are hardly 2,000 chip designers in India. And right now that number is around 100,000. So really India has gone quite a bit ahead in building chips. Pretty much all the multinational companies like the Intels, AMDs, NVIDIA, Broadcom, all of them have very strong presence in India. A lot of the chips get done out of India by the Indian engineers. Okay. Now, in the last 3-4 years, I am seeing some impetus, some momentum from Indian companies, CDAC, to build chips by Indian companies or Indian entities. And we are also one of them. In Kutrim, we are building chips. So the talent exists to design chips, and there is experience, and we are starting their journey. It will take time, it will take some patience, but we will get there. Because the same people are building chips for the MNCs. Now, when it comes to packaging and foundry, even a lot of the US companies, they're fabless companies. That means they depend upon foundries from TSMC and Intel and other foundries. So we will have to also depend on some of the external foundries. But there are initiatives right now to build some foundries in India and some packaging houses. And I think just a matter of time. The challenge there will be really how do we get that talent? How do we get the foundry talent? Because design talent we have quite a bit. The foundry talent we don't have as much. So how do we grow there?
We'll get to the talent question in a second. With that, I just want to move again to the next theme, I think, which is, again, really, I think, important. I'm going to come to you, Tanuj, on this next question. So just hold your placard. We need to discuss now, a few steps ahead, right? Let's assume now we have, AI infrastructure. It's built out. It's sovereign. The task really here under the AI mission is to make it accessible to people in India, right? Whether that's researchers, startups, enterprise companies who need it. I think how we want to frame this discussion today in this conversation is to try both identify the problem statement and then recommend some solutions, right? So when we're talking about this question of, access to AI, I think we should in this room first try and define whether we have access to AI and why we don't have access to AI, if that's a problem we're trying to solve. So, just to kick things off, if you can start with this idea of who's providing access to compute today. And, it's essentially the hyperscalers. And Rohini, I'm looking to you. And clearly there is a market for this compute and people are using this compute. It's a profitable business, of course, Microsoft in India. So what's the problem, right, when it comes to access? What is the government trying to solve for? And I know I should come to you, Rohini, first, but I'm going to actually ask Tanuj to maybe take this question because, Tanuj, you've been obviously talking about this problem of access, trying to create new and innovative solutions to promote access to compute. What's the problem? What is Rohini and co not doing right?
No, I don't think that's the way to frame it, Amdan.
Rohini,
you're doing a wonderful job. Please don't. That's not why we started OCC. I think the idea is that the cloud itself started as a idea around. I mean, remember how everybody was about let's move to cloud, right? And now that a lot of companies have moved to the cloud, there is also a certain sort of reel back and saying maybe some things are not meant for cloud, etc. And people are figuring out their cloud configuration, so to speak, right? And I think this is where there is a gap that we notice that for an India price point, sort of all these ways, if I had, if Sunil is a very ambitious person, he goes out and says, okay, 16,000 GPUs I'm going to be ordering. I have that much space, I have that much power, I have real estate, I can do all of that, right? I think there'll be a lot more entrepreneurs at a 5, 10 crore, 20 crore price point, at which point, they can start a data center, but whom are they selling it to, right? Because the Microsofts and the others, Azures and AWSs of the world want large data centers to partner with because they need to take large amounts of capacity and manage a large amount of capacity. So the gap that I feel that we can address here is that there is a missing middle, what we call the micro data center, which is, and there are some amazing examples of this in India already. There's a company right here in Delhi called Plank that makes data centers in shipping containers. Again, not a new idea, but they do it very well, and they let you just lease the data center capacity, right? Which brings me back to that previous question. I think I'm the only dissenting voice, so I would like to say this. What is sovereignty? One is self-sufficiency. I see a lot of ideas of self-sufficiency. I think number two is self-determination, which I think is way, way more important and way, way more urgent than self-sufficiency. You spoke about the export control bans from the US. That is the example of a thing that scares me more than anything else. There is one country or a few countries who may stop people from accessing this technology. Why does that scare me, right? Do I really care about one set of chips or etc.? No, it's because ultimately, let's not forget what we had said even at the start of this. This is a people-centric program. We want the people of India to have the benefits of using AI, especially it will be applied in education, in healthcare, etc. And if there is somebody else who can put a stop to that, that is what you should be protecting against first. Now, we might stumble our way into doing it. We might not make the best chips initially, whatever else. Those are problems for us to take care of. I think self-determination, which sometimes can be assured by thinking about the modern supply chains and all its entanglements, right? We don't even make an app today end-to-end, right? Which is all our own. Like if you use a front end, you're probably using React. React is not our own, right? You're viewing it on a browser that is not your own, a Play Store that is not your own, a cell phone OS that is not your own. So sufficiency in the software stack, I find like vague, right? And if you have something open source, isn't that good enough? So those are questions I would ask them on the software side. But yes, on the chips, etc., we should keep trying. But realistically, if we can't get to the power efficiencies of the AMDs and the NVIDIAs of the world, while we get there, we should still have access to that kind of compute at that efficiency, at that price point. Otherwise, AI in India for the people at the price point we need for the people doesn't happen, right? So that's the sovereignty thing, where I think self-determination way more than self-sufficiency. But yes, what is the problem that hyperscalers do not address? I think there is a huge number of businesses, MSMEs, who will come online, who will need AI. And they need a very specific class of AI with a very specific kind of AI infrastructure that I don't think is the primary focus of the hyperscalers right now.
I'd like to add here, very good point he made, is not just the access, but responsible access, which I feel the point I had made that, some amount of hand-holding is required, especially to the startups and the MSMEs, to tell them that, okay, your use case is not optimal, how to make it optimal, correct programming practices, parallelization, because now HPC AI is definitely converging, and it offers a much more efficient way to solve a problem than just getting GPUs and getting it done with. So I feel that responsible access probably would be a better paradigm in this case.
We have responsible AI and we also have responsible access. No, I'm going to.
I will have to respond to that.
Rohini, I'm going to come to you. I'm going to come to you first. Sunil, I'm going to come to you as well. But Thomas, if I can just ask you again, just to take us a step back, right? You've been following these technological trends for a while now, right? When it comes to questions of access and affordability, right? What are the emerging technology trends that we should be paying attention to India, right? To be able to promote access at the edge to the people who need it. It's a very complex demography. There are, rural customers with very, as Tanuj was saying, very different, perhaps, needs and requirements that hyperscalers are not being able to meet, perhaps. Is there anything on the technological trajectory that we should be paying attention to in India?
Well, I mean, there's the pace at which technology is changing for and driven by AI is just breathtaking. What I've been waiting to answer this question, the question that you framed, which was, what is sovereignty? And I would completely agree with what Tanu said, which is self-determination. But I will also add timeliness and urgency, right? So we sometimes confuse sovereignty with make in country, because those things the time scales don't align with the objectives and goals. So you have to keep the objectives and goals in mind. It does not mean that you should not aspire to manufacture, but you should not hold the advancements that you can make in AI and its impact on society and people's life, waiting to build up key parts of the supply chain locally. So I think I would, when I have difficulty sort of putting my arms around this sort of systems, I go back to the analogy of the electric grid or the electric infrastructure. The responsibility is to deliver AI capability to the citizens now or as soon as possible, to deliver goods and services that impact their lives, whether it's in agriculture, health, education, etc. And do it in a predictable, reliable, resilient way. And in the meantime, with the right incentives, private sector will look to see which part of the supply chain needs to be made here in India. We live in a globally connected world. Despite the kind of trade blips that you see, I don't think that is going to change. And so the important thing is to make sure that determine what you need to have in India, starting with data sovereignty, and then add to that stack and maybe sometimes delete from it as things change. So think of it as a systems.
Yeah. On technologies that can help enable?
Technologies, I think that the advantage continue to be in, so I think that we talk about hyperscalers because it has captured the imagination of people with ChatGPT, etc. I think the next big thing that's going to happen is AI on your PCs, on your desktops, on your phones, and out on the edge, because that is where you meet the 1.4 billion people in India. And so, to me, that is where the biggest opportunity lies.
Yeah, thanks, Thomas. Rohini, I'm going to let you.
Just one second, right? I think he spoke beautifully. Let's not miss out on that opportunity, what he stated. But if you go to simplicity, there are only two paradigms. One paradigm is that you run fast, capture the time, and win. And there's nothing wrong with that. And the second paradigm is that you understand what you're trying to do, which is the social economic part from where it started, pivot it on that, and figure out how you want to build. If living in India for all my life, I think that's what India basically looks at. And then he framed it beautifully. He framed it beautifully because we need to get onto the train. And we'll put in all the regulations and the safety part and things like that. We now need to get onto it because this is not about solving a problem. This is about productivity. This is about an AI factory that produces intelligence. You're working in a new industrial revolution. Just like we brought water, we put it over the fire, steam came out, and so many things have happened. Now you're bringing your domain experience, which is the data, and you're putting it into a numerical number, which is a floating point, and you're putting that into a factory, and factory is producing a floating point, which has the intelligence. And then you play with that intelligence, and you differentiate yourself. There's a new economy upon us. Let's not miss out what he's trying to say.
Sure. Yeah. No, Vishal, the stakes are high.
No, I just want to comment on the startups part, right? Because I think just like Sunil was talking about India being able to export compute, the reason startups come to a hyperscaler is because they also want to go global. Their ability to go global and serve SaaS companies like whether it's in Europe or other parts of the world, they need to be able to host data centers to be able to meet actual basic requirements of latency. So our job as a platform provider is to help startups innovate fast, understand the use case that the problem they are trying to solve, and from India go global. That is and in fact go to market together and go to customers together. That is what we try to do with startups. So I would ask our startups to actually not just think for India, but think for global.
Thanks, Tony. Hriday, Ranganath, I'm going to come to you next. Sunil, I have a question for you, right? A different question. So we're talking about access and affordability, right? This is clearly a key objective of the India AI mission. But as I mentioned early on, we need to ensure this is commercially viable, right? So can you talk us through some potential models in which, right, the government is obviously investing upfront in GPUs, they're looking at cloud players to help deploy this. We're looking at technologies like edge computing to get it closer to the people. But what is the commercial viability of this entire enterprise, right? How is profit sharing? How is CapEx going to be distributed across different actors in this entire value chain?
I think it is not so complicated as I think we all are feeling like, and there's a very regular cloud model. See, even right now, I am giving, sorry, I have to put my context just to explain the thing. Right now, I'm giving GPUs to anybody who wanted even for 1 hour or 1 week or 1 month or 1 year at something like $2.5 per hour, right? This is lowest in the world. This is almost 1/10 of what possibly is available in some of the developed countries. And I'm not cutting margins. I'm still making enough money. There's a business plan behind this. As I explained earlier, yes, there's a capex involved in acquiring chips, right? But there is a 40% extra which comes on the data center space, the power, the skill sets and internet and everything else. That is where India scores heavily. So even if I am able to see the demand that today I can transport, I can export it to world because that is a huge demand there and there is a scarcity everywhere. They will come to me if I'm giving the as good a quality of a GPU and a service at a price point which is low and I have got availability. Why will they not come to me? And that is something which I witnessed in the last couple of months. So that is my business model today, maybe 70% worldwide, 30% India. I would love this equation to change to 30% me serving the world and 70% India, but the starting has been made. And now if anybody says today in this room, Sunil, can you give me couple of nodes, couple of GPUs, H100s, right? Tomorrow I can give it. So first of all, the availability is not a question, and this is not a capex game. I think Tanush talked about somebody purchasing. We are not even talking about purchasing in cloud. For example, when Rohini is making a cloud or Amazon, Azure, Google, they are putting the capex, they are putting in manpower, they are converting into a usage model. That is what cloud is, and that is what we have done. So today, anybody and everybody in India can actually acquire it at a price, as I said, as low as $2.5 per hour. Now, the second part, sorry, just to share with you, and I think that is what PPP model in India AI mission means. Government is not talking about, as far as my understanding goes, of buying chips, because it's not a matter of buying chips. Then they will have to think, okay, somebody will have to make a data center, which will be 50 kilowatt per rack, which will be very complex data center, and there'll be a whole lot of paraphernalia around that. Government is also talking about, they will take it on a OPEX model from somebody like me, somebody like Microsoft or somebody, right, who will give it on as a service model. Now, $2.5 may be very, very good for, let's say, majority of the people. It comes into the reach of most of the startups who are reasonably funded. If government feels, no, it should be accessible even to the startups who are at a very, very seed stage. Maybe it needs to be available to students, to researchers who don't have any money. That is the delta from $2.5 to, let's say, a $0 or a $1.25, that is where this money should go of subsidizing. And there was a meeting, I think 2 weeks back in METI where some of this discussion was happening, and the secretary sir was very, very clear. Why should I subsidize? There was the demand of subsidizing either the manufacturers or the service providers, and I was very clear, and he also said, government need not subsidize people like us. They still need to subsidize the end user. We will give the most best service, we will give the best rate available compared to rest of the world. Whatever that price is, let government pay to the end startup and that startup so that they can pay to me. It's as simple as that. It's available today, commercially viable even today. What government will do will just add on the top of that to make the ecosystem much bigger.
So, thanks, Sunil. I have gotten a message saying we're time up. I know we're in the throes of a really interesting discussion, but really I need to start wrapping up. So I really want to go to the audience. I know you've all been a very patient audience packed into this room. I saw extra chairs coming in. So I do want to give you all an opportunity to ask questions. If there are any questions, raise your hand. I'll take a couple. You can come up to the mic up front and ask a question. I saw a hand up right here, the gentleman in the black waistcoat. Yeah.
Hi. So my question is to Mr. Sunil. And I have a couple of points noted if I can just go over them.
Please keep your comments to 20 seconds max.
Sure. So Mr. Thomas talked about some new approximation models where they don't update the weights and things like that. I want to make a case for smaller GPUs. They exist in the market. Why does India have a market for that? So Mr. Amlan Mohanty also mentioned about the market, the chicken and the egg problem, the market and the effort to make the GPUs and the data centers. Now, most startups, we are a drone company here headquartered in New Delhi, and we end up finding ourselves needing to use maybe 1,000 GPUs, but they're not 1,000 H100s, they're not 1,000 A100s. There are 1,000 smaller GPUs, maybe like, the older ones, 1060s, 1080s, 4090s, something like that. Almost no data center, including AWS, the hyperscalers or Yotta or Control-S or anyone, is able to give those at such large numbers. Now, I think that's where most startups are facing the challenge today, because most of us, when we are incubated, I find them to be developing models, testing, maybe Google Colab at the most of it, but at the end of it, we're not able to make a deal with the data centers.
Please get your question.
So that's the question, sir. I think like the smaller GPUs, services, startups, the gap probably in the market is not accessibility and price point, but rather the type of services and the type of GPUs available, which may be for larger companies, but may not be as appropriate for startups which are trying to make 1,000 GPU, like, AI engine, something like that.
We can talk offline. It will look like a marketing activity on my behalf in this conference. But
yeah, I think we'll move to the next question. Yeah,
so
gentlemen
we can
here.
talk about it. Yeah.
I'll take two more questions. Mustard shirt, and are there any more questions at the back?
Yes. My basic question is that we are finding that NVIDIA is basically innovating quite fast. There previously GPUs used to come within 3 years. Now they have come up with their Rubin, etc. after 6 months, 1 year. So basically, their GPU and which will put a lot of pressure on the companies, to innovate. Government will have to procure personal computers, PCs, software, cloud services have to. Will also have to spend a lot of capex. So do you see that that this will be a hurdle, as far as these innovations are concerned, and this will put a lot of pressure on the, everyone to innovate faster, So what will be the, the way forward, as far as this is concerned, because it is going to be very difficult to monetize these type of services at such a scale where billions and billions already NVIDIA is in trillions.
Got your question. Is there a pressure to monetize, Vishal? Your mic, Vishal.
So you don't have to worry about it because the software layer is abstracted. And that's why I keep saying it's about a game of an AI factory. And the factory will give you at the lowest cost. How Sunil and how everybody else will drive the cost is a function of how quickly I innovate and bring your costs down. And it's a good thing that's happening. It's a fantastic thing that is happening. He has a know-how, everybody else has a know-how. What you need is a price that's coming down, and you can innovate and your software is protected. We've done that for 70 years. As an industry, we'll continue to do it throughout our life. We'll give you your protection.
Okay, I'm going to take one more question. Yes, please keep it short, 20 seconds only.
Yeah, I will. Hi, just one question open to the floor. What do big tech corporations gain by supporting efforts to build a sovereign AI? And beyond that, what are the commercial interests that remain beyond helping a nation build a central AI platform?
Sorry, what of your question?
What commercial interests remain alongside helping a nation?
You're saying, is there a commercial interest to help build out
yes
infrastructure for a nation? Rohini, do you want to take the first part of the question? How are big tech companies dealing with this question of sovereignty? No, sorry, can you repeat the first part of your question?
Sorry, my question was, how do big tech corporations gain by supporting, that's the only question.
So
how do
his
big tech
question is fundamentally that if you're going to allow everybody to do it, then what will you do in this country?
Yes, essentially.
No, sorry, I will rephrase the question.
Yes, please rephrase the question.
Yeah, thank you
but
you
I
very
think
much.
at the root of
Vishal,
it...
really appreciate your help there. Always Vishal is a great friend. So
what's in it for you?
Here is the thing. Our fundamental model is of a platform. Our job is to help the end users innovate. So if it's a startup that is using the platform to create the product to help their customer, then we have done our job. So, that's the business model. We don't go into any industry that our customers are going into. We are not into retail. We are not into any industry that our customers go into. Our customers innovate on a hyper scale so that they are able to innovate at speed, at scale, go global. And that's our business model.
And I think that's a very good answer, because what she's saying, you have to go to the root cause.
Vishal, you're going to help me even answer the question?
Vishal,
not just rephrase the question.
I'm going to stop you there.
That's a bit much, okay? Mansplaining not required. Thank you.
Okay.
Thank you.
I can see we're getting a little feisty here. Folks, before I wrap up, before I just do some quick takeaways, I just want to get a last word from Thomas. Anybody else? Okay, Ranganath, one last kind of 30-second comments. I shall go around the room, maybe 30-second comments. Matey folks, please just give us 5 minutes more, and we'll get just last round of comments from everyone. Thomas, I'll start with you, and then we'll go around.
Just quickly, I just want to once again say this is an exciting initiative. and I want to congratulate the government of India and the AI mission. You know, we can splice and dice thing and focus on the small things. I think you have to abstract out and see what is the art of the possible, and whether it is big tech or a small startup. Ultimately, we do this to solve a real tangible problem. And the small startup to become big techs because you did that very well. So I don't think that you start any business because you say want to make money. It's making money allows them to stay in business so that they can continue to serve the public good. And so I think that's the way I look at it. This is a great opportunity. It's an exciting time. And so I just want to congratulate all of you, and I'm delighted to be part of this panel. Thank you.
Thanks, Thomas. Rangunath?
Yeah, just to conclude, I think AI is something that is essentially going to be pervasive. You need to take your application and data wherever it resides, right? You need to provide the resources there. So there was this debate around how the world should look like, whether it should be cloud-centric or whether it should be something on-prem. But truly, it's more hybrid in nature. You as a service provider, you as a person who wants to create value for yourself with the technology, need to ensure that this technology is available across the board. Wherever it resides, it needs to come to you. If it's on the phone, you need to have your capability to do that there. So when we say the world is moving to an edge, to a cloud kind of a centric world, it's all about your ability to be hybrid in nature. And AI truly is hybrid as a workload as well. So that's the message. Wherever it resides, the responsibility of delivering what it needs comes to us.
Any more comments, Anil?
So I think AI is about improving the lives of people. And India has 1.3 to 1.5 billion people here whose lives can be amazingly improved with access to AI. So democratizing AI should be the number one, kind of focus. And how fast can we bring that to fruition? The time constant of AI adoption has changed fundamentally. And I think that sense of urgency we all try to look at is how do you accelerate that time constant in India if the aspirations of this country to have the global aspirations, it is fundamental to see how do we get on the train and move fast.
Any more last words?
Yeah.
Today?
So I was hearing, constantly that, speed of innovation should not be missed out at all. And, the chips manufacturing may take time, that. I think that will be simply changing the goalpost in that case, because what Make in India policy says, what PLI policy says, it clearly spells out the stage-wise manner of manufacturing expected by a government, from Indian manufacturers. So that is already in place, and we should not change the goalpost by saying that chips are not getting manufactured. That is not getting manufactured anywhere in the world, and those who are trying to build their sovereign cloud, they are not using the chips which are getting manufactured in their own country. So that is number one. Second is, we already have the egg, let the egg hatch, and there is something which is very important, and I think the hatching can happen very easily with VGF in place, and at least the build, operate and own model to happen in India. And I think that is very well articulated by Government of India by their policy. And I think if these two things, if we let these two things happen, I think we are on the right track. So I would like to summarize with that. Thank you.
Okay, if there are no more comments, I want to do a quick round of takeaways from this discussion. By the way, I should just say, fascinating conversation. I've been in a lot of these discussions. I really appreciate all of the insights. On the first piece, right, around how India should be thinking about infrastructure rollout, I think the big takeaway, we heard this from everyone, is do it now. There is a sense of urgency that I haven't seen in a lot of other rooms. Maybe there will be some mistakes, but, deploy those GPUs quickly. Right? And I think we also heard that as you're doing that, experiment, monitor, right? Try and see what's working, and that will help inform how the next set of GPUs should be deployed, whether we need to acquire more GPUs, and so on and so forth, right? The other, I think, key element of this infrastructure build-out is that you cannot build that out in isolation. You need the data, you need the skills, you need the talent. So really think about being in a lens of, technical know-how, R&D that needs to work and be built out in parallel with the physical infrastructure itself. On the question of sovereignty, I think we got some really interesting concepts, right? This idea of, systems-based thinking to sovereignty. Think about building sovereignty across different elements of that stack, right? Think about, self-determination as an interesting approach to how India should be thinking about sovereignty. there's this idea about, intelligence being built in India, for India, by India, but I think it was very clear that to be pragmatic, this will need to be an iterative process, right? There is an urgency about this, and so we really can't wait for India to be building everything from scratch before we, start claiming sovereignty. And lastly, on this question of access and affordability, I think it was really interesting that we heard a few kind of emerging technologies that will help us bring, AI to the hands of the people. But I think what was surprising that commercial viability of this does not seem to be as complex an issue, right? So I think this again speaks to this issue as, don't worry about, finding the right market, finding the right price points, making sure this is viable for all of the market participants. Acquire, develop, deploy those GPUs now. Let's try and make India the use case capital of the world. Thank you, everyone. I hope you enjoyed this session. Round of applause for the speakers, please.
I also want to recognize the moderator. You did a fantastic job.
Thank you, everyone. That was a great session. And as Thomas sir has already mentioned, we would all like to acknowledge Mr. Amlan Mohante for a great role as a moderator he has played for this session. Hearing all the voice of the panel is a very difficult task in such a big panel, and we all appreciate that. Thank you, Amlan. Now, starting with the keynote panelist, Mr. Thomas Zakaria, we would like Amlan to facilitate Mr. Thomas Zakaria. Excuse me. I would request all the panelists to please remain in the hall. There are some short interview questions which our social media team would like to ask you. Social media. Now Amlan can facilitate Mr. Colonel A.K. Nath. Mr. Vishal Dhupar. Mr. Anil Nanduri. Mr. Anil Nanduri. Mr. Sambit Sahu. Mr. Tanuj Bhojwani. Okay, no issues. Ms. Rohini Srivastha. Mr. Ranganath Sadashiv. Mr. Ranganath Sadashiv. Mr. Hriday Vikram. Mr. Sunil Gupta. Mr. Gaurav Agarwal. Have I missed anyone or I have covered anyone? Mr. Gaurav Agarwal. Now, okay. Now I would request Ms. Pragati, our scientist from MIT, to facilitate Amlan, please. Thank you everyone for such a great session. We would request our panelists to please remain in the hall. There will be some short interview questions from our media team. Thanks.
Email ID is same, just general AI.
sharp edge, which is electric, right? Funky answer, Kalika answer. You need Jaya, who's the Jaya Jagdish, who's the AMD India head, and this will be an internet fund. I don't know what to do exactly, I'm not interested. I'm currently so you go for Convening India. Okay? I'll try and see if I can catch you with Jaya. I'm sure they do. It's like a India Internet Fund.
class as 3. Dedication is se può matar, se no se può matar.
What's the message to you? Microsoft, AWS. Just AWS go. Carnegie. No, it's all this.
So welcome back. This is extremely interesting session where we would explore the partnerships, the ideas which are being sort of discussed since morning in terms of how we actually go forward, what kind of collaborative approaches are possible, what kind of universal thought process we can really have to bring in partnerships not only globally as the very focus since morning is, but also in terms of how do we bring in Global South into the picture. What kind of efforts are required to be made to take that process forward, as Honorable Minister emphasized this morning about inclusivity. How do we bring in inclusivity? How do we bring in issues which are in a way ensuring both access and inclusion within this revolution that we are seeing. Also, the collaborative AI would bring in issues in terms of how we go ahead with partnerships, what kind of role that we see countries to play, what kind of entities that can come up for our partnership, and also in terms of providing the necessary fillip with the private sector so that we have sort of efforts which are needed for access and inclusion without compromising the necessary engine of growth, which is innovation in this sector. So we need to have this delicate balance that can bring in the benefits of AI for everyone, trying to bring in to all the regions in the world and do not make it in a way sort of expensive, which is in a way is being tried. As we heard this morning, the G20 presidency of India tried to introduce the idea of the digital public infrastructure, how GPAI is actually going to bring in this access, equity and inclusion as part of the focus that AI requires. And for that to take forward, I have an extremely accomplished panel. It's a rather, I would say, fair balance in terms of the private sectors, the innovators, the policy makers, and also the entities which have been doing the great work in terms of industry grouping, but also in terms of how entities like OECD and others who are analyzing science, technology, policy, and its impact in terms of ensuring this access, equity, inclusion component adequately addressed. We also would very much like to mention here in terms of how we see the public-private partnership. The idea of some global governance mechanism would come up seems to be a sort of distant dream at this point, but we would require something to come up as we are seeing, at least in the finance sector. It is required more and more intense discussions and debates as countries introduce digital currencies, as we see cross-border payment transactions being sort of secured, and more options beyond SWIFT are emerging. So the new global public goods which are emerging in the finance sector, with growing integration of the global south and the economy, and the statistics from the World Bank which have just been released are absolutely clear in terms of pace at which international trade is expanding within the global south. And you find that the e-payment transactions are growing 3.5 times more within the global south. So this beautiful paper that International Monetary Fund released just last month, it very clearly brings out the gravitas of this change that we are seeing in terms of growing digitalization of trade within global south, and that also within few countries. So you have far greater challenges in terms of managing this science policy perspective that is required, and also in terms of how we can bring in this delicate balance that I referred to in terms of public-private partnership. The perspectives of countries which have come up with different development strategies are looking more sort of polarized, and in that the scope for contestation in terms of policy positions by countries, by delegations, by national governments or international initiatives, they also seem very, very polarized. So in that backdrop, this session is trying to bring in the ideas in terms of collaboration. How do we leverage on complementarities that exist, both in the regulatory framework, but as I said, without compromising innovation. So that balancing would be extremely challenging. The willingness for avoiding governance would be actually jeopardizing the future introduction of technology and the AEI, access, equity and inclusion that I said. So we need to act in time. Countries that have already introduced CBDC and are going forward, the Bank for International Settlement is taking more time to decide, but it is becoming more and more complicated. Central banks are globally concerned about this. And this is not one sector, but it has spread to many other sectors. Many more infrastructure and finance-related sectors are getting affected. So we don't have luxury of time. Technology is expanding. People are introducing. We need global frameworks to come up. We need efforts in terms of how countries agree, at least on some minimum principles, so that we take off and we take the dimensions forward. As I said, the panel is extremely accomplished, and I'm sure we would, at the end of this panel, would have some light at the end of the tunnel to see what direction we need to go in. On my list, the first speaker is Shri Rohit Ratish, who is Joint Secretary. And some of you may be aware, India established in 2011 Development Partnership Administration, DPA, in the Ministry of External Affairs. This is a division which spearheads the Development Partnership Program of India. Of course, the concerned divisions, but this is the one that is doing the thinking that is required in terms of supports and to our partner countries. Some of you must be seeing how Global South's rise is also being adequately supported by countries from the South. And you find that the share of official development assistance, ODA, in the development finance flows across the world is going down, and the partnership within the Global South is going up, both for infrastructure, for policy lessons, etc. So DPA is playing an extremely important role, and he himself is very closely involved in the issues that are related to digital public infrastructure. And the future vision that is required. The G20 presidency of India, as I said, has placed DPI upfront. Countries are taking them forward, and we are seeing how the polarizing perspectives in terms of what role, and that we are discussing since early 90s, role of state and market. That question is haunting us back, and with this advancement in technology, the question is far more clear, and the lessons that we have from the great miracle, the famous report that World Bank produced, the question is still not settled. The idea of this delicate balance between role of market and state is something which is very important in light of DPI. So without further ado, let me invite Shri Rohit Ratish for his remarks. Over to you.
Thank you, Professor. Distinguished speakers, ladies and gentlemen, good evening to you all. Let me thank the Ministry of Electronics and Information Technology for inviting me as a representative of the MEA at the Global IndiaAI Summit. More so for this particular session on collaborative AI for global partnership. From an Indian standpoint, it is a timely initiative to deliberate on the necessity for different actors in our country, the government, the consortium of industry representatives here, and civil society, to align, collaborate, and present to the world the idea of collaborative AI as a force for global good. That AI matters to us is established and is foregrounded by rapid advances in generative AI applications and compute power in the last 3 to 4 years. What undergirds and propels our discussions today on collaborative AI is how its immense power and potential can be harnessed within and across nations to help deliver on common goals across geographies with varying levels of human and economic development and for the global good. In this context, the adoption in March this year of a resolution by the UNGA on steering AI towards global good and a faster realization of sustainable development is cardinal. This UNGA resolution resolves to bridge AI and other digital divides, and both within countries, and to promote safe, secure and trustworthy AI systems to accelerate progress towards the full realization of the 2030 Agenda for Sustainable Development. This can be seen in the light of the GPAI Ministerial Declaration of December 23, which put at its heart the need to collaborate and create applications of AI in healthcare, agriculture and other areas of socio-economic development that concern all of us. Ladies and gentlemen, as you know, AI will have a profound impact on the way we as a society think and operate. A PwC study predicted that global GDP will see a 14% bump by 2030 due to AI. However, much of this GDP growth is likely to be concentrated in a few countries, especially in the West. Are we then to mainstream and enable an AI revolution that treats the global South as a reductive geography to data sources and users and consumers? The concerns in the global South are many, from misdiagnosing an indigenous breed of cow in Kenya to the dearth of adequate data centers, cloud computing and cybersecurity infrastructure, from the need to uplevel and upscale human resources and curricula to meet AI's potential and to curbing risks that reside in data privacy and governance in the global South, from design flaws and ethical biases in algorithms and neural networks to the barriers for access to data, testbeds and trained models. If we hesitate to meet these challenges head-on, AI can widen and deepen developmental schisms and inequities. For AI to be collaborative and tackle the diverse set of global and societal challenges we face, it is key that India plays a role in shaping both the narrative and the execution, with the concerns of the global South in mind. Alongside being home to the fifth largest economy and 18% of the global population, India now ranks 8th in AI patents and 4th in AI research papers. India's leadership of the G20 last year cut the mustard on matters of global governance, of technology, including AI, data for development, and digital public infrastructure. To voice the concerns of the global South community that India belongs to is now a mantra of our foreign policy today. Ladies and gentlemen, India's role as a development partner to the global South has grown in the last 2 decades. Our status as an aid recipient not too long ago shapes our vision and approach to development partnerships, one that is driven by the needs and aspirations of our partner countries. Our development partnership projects and initiatives, with presently a financial outlay of approximately $40 billion, spans about 70 countries in the global South and covers infrastructure, roads, ports, railways, power, as well as education, food security, health, and disaster relief. Every year, we train around 15 to 20,000 civil servants and professionals from across the global South, 40% of them women, in subjects that range from governance, management, the sciences, the social sciences, gender, climate and renewables, technology and finance, at various training institutes across India through MEA's flagship iTech program. As we speak, a customized training program on responsible AI is being held near this venue at CDAC through the iTech program for 15 professionals from the Dominican Republic. I say this to spotlight our emphasis on demand-driven development partnerships that puts human resource development at the core of it. Ladies and gentlemen, secure, safe and trustworthy AI holds the promise of better education, health, prosperity and well-being for all, including the citizens of the global South. On the other hand, insecure, unsafe and untrustworthy AI is a force that can throw sand in the gears of our common ideals and objectives expressed in the 2030 Agenda. Collaborative AI for global partnerships, therefore, is not just an idea whose time has come, but also a virtue of necessity. To my mind, a task force, if you will, under the rubric of this session of government, industry and civil society would be useful to harness our efforts and expertise to democratize AI and to make it work for all, including the global South. And what better place to unpack the different streams of thought and action than here at this summit, and what better time than now. It took 2 months for ChatGPT to reach 100 million users, something that took fixed telephones 75 years. We see the proliferation of generative AI applications in large language models and predictive algorithms in our daily lives today, and cannot help but think that artificial general intelligence awaits us in a not so distant future. Ladies and gentlemen, we are at a tipping point in human history. Our ideas and choices and actions today will echo deeply into the future across generations. And those generations on this planet will need to coexist and hopefully thrive with AI, this new digital species that we have created. I thank you for your patience and hope that your thoughts are provoked at this summit and its discussions. Thanks.
Thank you. Thanks, Mr. Ratish. Let me now invite Joint Secretary with MITI, Shri Suresh Pal, who has been Sushil Pal, who has been leading the work that has led to, for the first time, multilateral understanding on and consensus on DPI. And this is an important achievement for the G20 presidency that India had, and also in terms of shaping the agenda forward in terms of how we look at the issues that are coming up, which Mr. Ratish mentioned in terms of their complexity, and also the whole morning today, afternoon, we have been discussing these dimensions which Mr. Sushil Pal would bring in. His important contribution as co-chair for Digital Economy Working Group within G20 is also an extremely important element here, which I wanted to mention in terms of how we are seeing the governance and dimensions of engagement, partnerships within AI to see how we go forward. So without further ado, Sushil, let me invite you. Thank you.
Thank you. I'm supposed to speak on the democratization of AI and the national efforts and the global initiatives taken by India. Looking at the expert panel we have and the audience we have, I think I'll also touch upon the challenges which we think, especially from the Global South perspective. AI is certainly the most transformative technology of this century. Sounds like cliche, but I think I got to start saying with this. Some, call it the greatest invention since the internet. A few call it maybe as transformative as the printing press or the electricity. But certainly it holds extraordinary potential, both for the promise and peril. India's approach to the AI is summed up in its national strategy for AI, which essentially is to leverage AI for the social good and ensuring its ethical standards at the same time and respecting the principles of transparency, accountability, privacy, and security. Keeping AI for all and AI for good at the core of its heart, we have taken steps towards democratization of AI and digital economy, both at the national level through the Indian AI mission, as well as at the global level through the multilateral initiatives like GPAI and G20 as well, and even the present ongoing discussions in the GDC. Democratization of AI is at the heart of India's approach to the deployment of technology, and this is evidenced by our DPI approach, and this approach which we got adopted for the first time in the G20 forum as well. It itself envisages a multi-stakeholder approach, which includes both the government, the community, as well as the private sector. The beauty of this approach that it's a pretty participative approach, and which makes sure that there are no entry barriers even for the smallest of the startups, and also ensures that there is no monopolization of the technology. This government has played a key role, not only in designing the DPI and laying down the rules of the DPI, but also it has made a lot of investments in the DPI, be it Aadhaar, be it UPI, be it Ayushman Bharat, which is our health DPI, or be it DigiLocker. I believe that the same approach we need to adopt for the deployment and designing and deployment of the AI as well. As the founder and the current lead chair of the GPAI, India is leading the efforts for effective multi-stakeholder collaboration for responsible development and use of AI. To further its vision of democratization of AI resources and equitable access to the benefit of all of AI, India proposed the adoption of collaborative AI for global partnership as a new thematic priority area in GPAI, which was approved and adopted by the almost all 29 member countries last year in New Delhi's GPAI Summit. Coming to the challenges, one of the objectives of this convening is also to deliberate and highlight upon the challenges and the opportunities. Conversations around the opportunities are more or less similar, be it across the global north or global south. It is the conversations about the challenges where we see a stark difference vis-a-vis the global north and south. The G7 conversations about the challenges of AI largely revolves around the right-based and the risk-based approaches, largely talking about the privacy, security, and transparency. However, when you talk about global south, on the other hand, we are still grappling with the issues of lack of resources like compute, the skills, capacities, quality data sets, even the ownership and control of data is the issue here. And at the same time, the bias and the discrimination in the existing AI models. This is largely because of concentration of AI developmental ecosystem with a handful of organizations. AI system should seek to reflect the diverse range of linguistic, cultural, racial, and geographical context to mitigate the perpetuation of existing biases, existing systemic biases, and also to avoid the future biases. Standard is another very important challenge for developing economies. The standards can actually contain risk, can accelerate safety, and can also enable interoperability. For AI, we need to divide the socio-technical standards, which contextualizes them to the local requirement of each countries and describe ethics and ideals, and also provide technical means to achieve them. As for the standards, it's important that the Global South join this bandwagon of standards as early as possible. We missed the bus on the technical aspects and the standards of internet, and we're still catching up. We still don't have any clue as to how the packet moves on the internet, and none of our countries have even the test beds for testing out these technical aspects of the internet. We are primarily the users of internet only. And I'm sure we don't want the same situation in AI a few years down the line. Therefore, I believe that the states need to have a substantial stake in AI design and development and deployment, which at present is dominated by a few organizations and a few countries only. We need to reimagine the public-private partnership models and build regulatory sandboxes wherein the experiments of the entrepreneurs are matched and weighed against equitable solutions to societal challenges. Another important challenge for Global South is the risk of widening income gap, as AI productivity gains are largely captured by a few wealthy nations and a few firms. Further, AI could potentially erode the competitive advantage of many developing countries, which is largely the cheap labor. As AI automation advances, it would drastically alter the existing economic incentive of the trade and investments. While on one side, the Global South countries need to create jobs for the growing young population, on the other hand, AI automation would really upend the traditional growth models and developmental strategies. Hence, AI requires very careful navigation in many of the developing countries. Therefore, overcoming the increased concentration of AI development ecosystem within a handful of organizations and economies require collaboration and coordination at multilateral as well as multi-stakeholder level. To bridge the AI digital divide, India is encouraging a multi-stakeholder engagement through forums like GPAI, G20, and Global Digital Compact. We are happy to see that this initiative has found traction with the current Brazilian presidency as well, wherein one of its priorities recognizes the challenges which emerge from the inequitable distribution of the AI resources, and as well as finding pathways to leverage AI for inclusive and sustainable development. With this present convening, we look forward to the perspective of different stakeholders and experts to identify institutional mechanism for implementing the collaborative AI for global partnership goals. Thank you.
Thank you. Thanks a lot, Sushilji, for setting the broad context for today's panel discussion that we would begin now. You have identified, as I noted, 8 broad points, which I'm not getting into right now. We have a very, very rich panel, and the fun of getting such panels together is that from organizers you start getting slips on time management. So I'm told that we need to close by 6:30, and I would request all the panelists to help me manage time as sort of indicated. 4 to 5 minutes for each panelist would be very meaningful. Let me begin with Devjani, who has already been introduced to all of you, I think, at different points in the day. She has been leading NESCOM and also one of, I would say, a public intellectual who has been thinking in terms of how the public-private participation in management of new technologies is addressed. I had opportunity of interacting in Niti Aayog's meetings with her, and the whole idea in terms of how we bring in technologies in underserved regions is something, Devjani, that I think in context of AI is extremely important. As we heard in the opening remarks by Shri Sushil Pal, the issue of Global South's participation and their ability, the enabling part of it that is required, is important. We also heard our colleague from Ministry of External Affairs, Mr. Rohit Atish, in terms of he suggesting a task force of bringing people together. How you see some of these points that have emerged from the initial remarks and the opening address today in terms of partnership between public sector and private sector? And then over to you.
Thank you, Sachin. You know, as I said this morning in the opening ceremony, this is a very interesting time in the AI world because there are literally 2 parallel universes coexisting. There are 2, as I call them, 2 truths that's coexisting, right? One truth is AI is absolutely transformative. All of you talked about it, and it's great. And the second truth is that we have still not seen what is the big problem that AI will solve and at scale. Right? There's a lot of debate. Is this, especially given the amount of money that is being invested in AI, I think people are now waking up to what problem will this really solve. There are examples, there are very good examples in healthcare, drug discovery, etc. But again, where we see the biggest challenge or roadblock is how do you apply those at scale? How do you ensure that everyone in every country benefits from it? Which is where the AI narrative breaks today, right? Now, I think this is a beautiful opportunity and a very timely opportunity for India and the Global South, because we have had the experience and, we have demonstrated population level scale of technologies using some basic simple principles, and I'm talking about DPIs, right? And I think this is a fantastic opportunity for the Global South to come together to really focus on how do we make or focus on the applied AI challenge. How do we make AI real? How do we make AI work for us? What problems do we get it to solve at scale? And I think this is a fantastic opportunity for the Global South. To do this, there are a few things that we really have to get very serious about, whether it's a task force or whatever, but what matters is the outcome. One, we need enough patient capital in this region, which today does not exist. Whether it is to go and build the kind of compute that is needed or invest in deep tech, this region is starved for patient capital. How do we come together to build capital? Because that's something that often doesn't get talked about. We have to improve the talent density in this region. It is not just about upskilling and reskilling people and creating talent. Most of the good ones will go. And they will build the AI solutions, but they will build them somewhere else. We have to build talent density. We have to skill and we have to retain. And if possible, get people back. Because a lot of people working on AI in whichever part of the world are from our country. So how do we get them back? Third one, we talked about data. It's not just we are sitting on hordes of data, but how do we unlock the data? How do we provide access to data? And I think, when you're talking about applied AI, what you are looking at is, and where the opportunity is how do you use domain specific, take the data from a particular domain, and how do you build those vertical solutions? It pretty much built on what DPI did. DPI solved specific problems. There were horizontal building blocks, KYC, digital identity, or whatever, the interoperability protocol. There were horizontal building blocks. But then what it did beautifully, and why it scaled so beautifully, is because it went after one specific problem. And I think that's the model we have to apply when we are thinking about applied AI, is where we really go domain by domain. And therefore, thinking of the data from that perspective, that lens, is going to be very useful. And last but not the least is how do you create an environment for innovation? I'm sort of tired of everyone talking about regulation, but what are you going to regulate? We are still so early in the AI journey. What are we going to regulate? Whatever we are going to regulate today, we are going to be back at the table a few years down saying we have to change everything. Okay, so how do we instead look at creating an ecosystem, an environment where innovation thrives with ethics? Ethics is going to be a game changer with ethics. And therefore, my last point is, I think the role that, and I sort of really hope to see India play this role, but the role that I think India and Global South will have to play is bring the human accountability and responsibility back in the game. Somewhere in the AI narrative in the Western world, we have started believing that humans are not going to be important anymore in the game of AI. And I think we have to change that narrative completely. There's a lot of talk about putting humans in the loop, in the AI loop. I believe we have to change that, and we have to figure out how to put AI in the human loop. And it's about human centricity and putting humans first. So those are the few points.
For bringing forward the point of ethics, and I think this is so much important now for us. As you may recall, some of us who have been tracking evolution of technology, I'm thrown back in 1999 when I was tracking biotechnology, and we compared a volume that my institute did back in 1986. And it was a hefty volume listing possible dangers of biotechnology. And then we revisited in 2006-07, and I was part of NESTI of OECD. And 2001 and 2, we produced a volume as to what were the dangers people saw from biotechnology and how many of them materialized. The only challenge we got from none other than a country like China. In 2018-19, they produced the biggest challenge in terms of violation of ethics, and that was in form of synthetic babies, the twins which came out. And the genetic manipulation that was done for those babies was, amazing, that they would never get cold and they would never have a jaundice. So with that, those synthetic babies now are 3 years old. And this is where the world outcry was there in terms of ethics and what you very beautifully said, human accountability. So I think ethics is something that we need to emphasize and we need to bring back in the governance of technology. UNESCO is doing, and I understand that the G7 presidency of Canada next year has already chosen governance of AI as sort of thematic focus for G7 presidency. But you're absolutely right. Let me now bring in somebody who has been handling science, technology, innovation for some time at OECD. And as I think our opening address by Mr. Sushil Pal very rightly said, democratization of technology and bringing in inclusivity, what we heard from Debjani in terms of human accountability. I wonder how OECD looks at it in terms of science policy, Mr. Jerry Shine, and how you see the possibility of having some sort of task force, which Mr. Rohit Ratish mentioned, of a multi-stakeholder, which was also emphasized. So over to you, and as I mentioned, 4 to 5 minutes. There we go. Thank you. Well, I think with that introduction, with the range of topics, it's good to remind me to try to keep to 4 or 5 minutes, because I think there's very much we can say on a number of those directions. Let me just start. I mean, to say what I'll talk about is maybe turning the title around a little bit too. What we can do about global partnerships to advance on collaborative AI. And I think, to that note, you're all familiar with the global partnership on AI. The role that India has had in the partnership over the last year and coming into the next year, and the focus that it has placed on trying to be a gateway to the global south in terms of inclusion and inclusivity on these issues. And I think that's to be admired and is widely recognized. What we've been discussing today are ways to sort of build and strengthen the GPAI, the Global Partnership on AI, through an even closer integration with the work that we do on AI at the OECD. So what this means is a so-called integrated partnership that would bring together all of the 38 OECD member countries with the 6 non-OECD members, of the other GPAI members, into an integrated partnership. That means we'd have 44 countries of a fairly broad and diverse economic and development footing, working together on equal footing in an inclusive framework to help us try to advance, and I will say advance because we need to do more on AI, but to do it in a way that's safe, secure, and trustworthy. So we have countries now. India is part of this, of course, Argentina, Brazil, Serbia, Senegal, Singapore, plus the 38 OECD countries that will be working together, and with an ambition to expand that inclusivity, to bring more countries around tables like this. They'll have to be even larger than this as we go forward, because there is an ambition of trying to grow that, to bring in more diverse perspectives from countries who, to different degrees, do have a shared commitment and are facing some very shared challenges. I mean, those that you highlight, with AI developments being very much centered in a few countries, many other countries are looking for ways that they can get more engaged in AI developments and how they can benefit from it, not just as consumers, but as producers as well. I think the partnership too is important because it brings together not just policymakers around the table, but it has the so-called expert groups. Right, so we bring together multi-stakeholder, multi-dimensional expert groups that have been operating under GPAI. I think I heard a number today. There are 250 experts in various domains that have been working on projects to help understand how to improve the development of AI and how to inform development of AI that is more safe and is more transparent and explanatory. We at OECD have also had a network of experts. It's been about 400, 500 people who have been working together now. We're going to combine these so that we can have experts who are working in response to the policy needs and who can then better inform policymakers about successful policies that we can try to implement to promote development of AI in ways that will be it will be used for human good and to bring good to all. I think in that model too, we look at some of the other resources that are available, right? So we've been developing over the last several years the so-called AI Policy Observatory, which brings together information on AI data, on trends, job trends, venture capital investments, and so forth. And maybe more importantly, for those who are trying to make progress in the space of AI policy and AI governance, information from more than 70 different jurisdictions, more than 1,000 different policy initiatives, some of which are broad about national strategies for AI, and some very targeted toward the very applications that you were just mentioning. How do we have safe and secure AI in health and healthcare? How do we use AI to advance sustainable development, sustainable agriculture? So I think the inclusivity of that resource as well is something that can inform policy developments in a number of countries, as can a set of tools and a catalog of tools that we've been developing primarily for policymakers to help understand the distinctions between different types of AI, the benefits that they can bring, the risks that they pose. There's a difference between the face recognition that's used here to let me get into my iPhone and the generative AI that's captured the public attention, right? So we know that AI tools have been embedded in virtually all of our digital infrastructures these days, and how do we understand what the risks and benefits of those are so that we can take appropriate and proper policy measures. I would say, again, just to reinforce the notions you've been looking at, we've been looking at how from a country level down to the level of individual firms, how do we see the most positive and productivity benefits from AI adoption and use, and we have found it is very much, and we have now some evidence to back this up, very much tied to the availability of skills, the availability of compute, the availability of data and accessible data, which itself, like AI, we need to take steps that both promote and encourage the accessibility and the availability of data and put it in forms that can be readily used, while at the same time respecting privacy concerns and other security concerns around those data to make sure that they are used with trust. So aligns with one other, and I'll end on this note, one other initiative that we have launched at OECD now, which is related to data free flows with trust, or DFFT, which is trying to look at broadly and in individual sectors, how do you encourage greater data access and accessibility and use, while at the same time ensuring that the trustworthiness there and the protections are there so it can be used in appropriate ways. Of course, we know that those data can be used also for training AI systems as well as a range of other applications. So I think the two of these go together and will give us a good policy front on which to work forward. As I said in the beginning, with a more inclusive set of countries around the table and with a growing set of experts helping to inform and advise the policymaking community. Thank you. Thank you. Thanks, Jerry. I think you have rightly emphasized in terms of bringing multi-stakeholder partnership that OECD has already tried, and the group that you alluded to probably, I think, would help in terms of taking this forward. Let me now bring in the other side of the table and bring in people who have been upfront in terms of addressing this from the private sector, from in Mobib. Shubi, you have been addressing this issue in terms of how you look at these partnerships, how what Debjani said is too early to bring in regulation, and how you see the opportunities that Jerry was referring to. So Dr. Shubi Chaturvedi, over to you.
Thank you so much, Sachin, and thank you, Sushilji and Rohit, for laying out the framework and the context. We're often laying out the point of being in a room full of white, male, European perspectives. So you've been very brave, Jerry. We also want to thank you for the work that OECD has been doing. Sushilji, when you started the conversation with multi-stakeholderism, that was truly music to my ears, because it is often, we're speaking to the converted, and there are often voices in the room which are not present. So when we look at anything which is being done with a public policy lens, it's usually for public good, in public interest, and after public consultation. So many congratulations to Government of India, METI, as well as MEA for putting together a very robust set of people in the room so that voices are not being left out. In Mobi, started in 2008, by 2011, we were India's first unicorn when it was not a buzzword. Not only did we start as a startup, 4 young boys from Uttar Pradesh. If Uttar Pradesh was a country, it would be the 5th largest country in the world. So we are known for size, seizing every single opportunity, and for disrupting technologies that look at frugal innovation, which is at the heart of everything that we do in India. So when we looked at the topic of the day today, the perspective was, how do you build, how do you solve for developing countries, how do you solve for small island landlocked nations, how do you solve for women and children, because that's what is at stake today. So a lot of work has happened, Sachin, on the areas of internet governance and cybersecurity, where ISTAR organizations have played leading roles, where informal as well as formal processes and voluntary standards have come into place, whether we look at IGF, IETF, ICANN, ITU, and this is so important where AI is today being, and not just Gen AI, because it's often being used synonymously, because it gets a lot of spotlight for the right reasons, has more articulate spokespersons. Very, very important to understand that democratizing AI is not just good ethically, morally, strategically. It is no longer a choice. It's an idea whose time has come. It is an imperative because it also makes economic sense. So there are various statistics and reports that our friends at PwC and the World Bank have already put out. Every 2% increase in just broadband creation leads to about 2% increase to the economy and GDP. For countries like India and the global south, this is a direct impact on not just job creation, but also job transformation. So good for business, good for people, very, very important now to look at it with a solutions approach. We believe that if there is government engagement, and that's the core principle of multi-stakeholderism, where not just government, civil society, media, academia, industry, everybody has a voice, but to make this equitable, we have to ensure that there's open access, there's equity in participation, there is an active effort on the part of global governments to make sure that you're in the room. And that has been my personal journey, where you looked at the multi-stakeholder advisory group of the United Nations Secretary General. I had the fortune of being backed by both ISOC and Government of India's NICSI, which is the .in registry. I still had to stay in a red light area because we couldn't afford hotel rooms in Geneva. So if you're not in the room, if you're not at the table, you're going to be on the menu. So one, not just producers of AI, not just consumers of AI, now you have startups, entrepreneurs, you have people who are challenging status quo, specifically for emerging countries, developing economies, future technologies. Law is always going to be playing catch up to policy. So when we look at NIST standards, when we look at the work that the OECD does, it informs a lot of conversations. However, realizing that there is no blanket one-size-fits-all solution, and here are some of the recommendations as to how we take this forward. Rohitji, stemming from your conversation, can we look at a task force? So we believe at least 3 or 4 actionables, and this is where I'd like to end and yield my time. So one is creating an actionable roadmap for democratizing AI resources. And that's where I think India's AI mission will play a huge role, because not just access to quality data, data poisoning is as real an issue. So if we can look at liberating data in the areas of regulatory sandboxes, trusted green corridors, just the way we've done for manufacturing and electronics, if we can do that for digital services, so that startups can innovate and build, especially in the areas of health tech and AI, that's an opportunity right there. Because when we learn and when we see businesses and startups collaborate, that's when the real value will get unlocked. There are only so many times that global governments can bring together everybody, get them in a room, get a venue such as this in the heart of Delhi. So this connect then becomes organic. Then under the US-India CEO Forum, India and US are already collaborating. They've set up an initiative called NIHIT, which is a knowledge network. And even for unlocking global trade, we realized that both AI, cybersecurity, skilling, which is the real gap in terms of talent, and that has to translate in training the trainers, ensuring that NVIDIA, AMDs of the world are bridging our course curriculum. So even when you're looking at engineers from electronics and VLSI, they're not really ready for AI. It's not just compute. What do we teach? Are we making sure that our curriculum is updated? And that's where a joint resource center, online collaboratory, just in the models that we've used for digital diplomacy and decentralized models of internet governance, they bring in and unlock the real value of multi-stakeholderism. And AI data commons is something that we'd like to propose, because when you look at questions of jurisprudence, a lot of people have tried looking at a global model for internet governance and cybersecurity, taking it to The Hague hasn't worked. So multilateral collaboration where it comes to sovereignty, where it comes to legal issues, where it comes to national security, has to rest with the government, where MLATs are going to be a much easier solution. But when it comes to creating the value of data and AI data commons, which allows for global researchers to create a repository, becomes an accessible program. A very, very strong appeal to governments worldwide to create a global AI fellowship. We heard that there is a similar attempt being made by Government of India, where some fellows have been invited to this edition, but this has to be a continuing program, where you're able to bring in younger voices and create the next generation of leaders for AI leadership. Believe me, from the time that we've come in, 20,000 people have come online already. So not only do we want to bring new people online, we want to make sure they have an experience that's safe, trusted, and that makes sure they're able to use this amazing tool for not just disruption, but also innovation. And lastly, AI for good and establishing AI ethical standards. So while regulation, and I wholeheartedly echo what Devjani said, let us not put the cart before the horse. We are not saying we want a wild, wild west, a lawless, framework-less ecosystem for innovation, but it's equally important that we do not stifle innovation. Now is the time for AI proliferation. So from a private sector, industry perspective, where a lot of heavy investment decisions get taken, where we make presentations to our boards and they approve investments, stability of policy, a light touch governance framework, and a collaborative approach where we do this very often and not as a, let's say, a bi-yearly exercise would be some of the submissions from the lens of the private sector, a former academician and a civil society member and a teacher at heart. Thank you again.
Thank you. Thanks, Shubhi, for bringing forward ideas which would help in terms of turning some of our understanding on governance component into practical action. So thanks for your intervention. Let me now turn back to Mr. Anirudh Suri, with whom India Internet Fund and couple of other initiatives in this sector have prospered very well. You have been somebody who has seen this dichotomy of producers and consumers of AI, and that dichotomy is far more challenging for the Global South. And I was wondering how you see the suggestions that have already come up in terms of taking the idea forward in terms of at least coherence and understanding the idea of ethics and their centrality, but also this dichotomy of producers and consumers. So over to you, Mr. Suri.
Thank you so much, Sachin, and thank you to everyone who's shared inputs before I share some of my thoughts. I'll make one big point and then I'll build on that over the next 3-4 minutes. I think, much like Devjani, you said that there's no point regulating a technology that is so fast evolving that you'll find yourself probably on the wrong side sooner than later. I think as far as governance is concerned, promoting fair, inclusive use of AI is concerned, I think unless countries in the Global South build competitiveness in AI, there's no point in talking too much about it, because you won't have a seat at the table unless you are bringing something to the table as far as competitiveness in AI is concerned. So I think that's the first big point I want to put out. And this is basis, I think, everyone's experience, whether you see it in the consumer internet space. I think, as Sushilji, you also said that there are many pieces of the internet governance puzzle that we are not part of, not on the table for. And one of the reasons for that is you didn't have the internet-driven competitiveness and capabilities early enough. And I think we can talk till the cows literally come home about regulation and how much we want ethics to be part of the governance and how much we want the Global South to be at the table, how our problems need to be solved using AI also, and not just the problems faced by the developed world. But I think none of that will realistically happen unless we've built competitiveness in this space, not just as India, but I believe as the Global South, so that we are not left behind in yet another revolution as we were in the Industrial Revolution and earlier revolutions. So now with that main point, I'll break that down along the 5 or 6, I would say, building blocks of AI competitiveness, some of which I think have already been laid out. Compute is obviously the one that has been talked about the most in the last couple of years, and I think I'll defer to Vishal, I think Jaya, and Annabelle. I think you three represent companies that are at the forefront of compute, either in terms of the hardware or cloud computing for AI applications, AI researchers. So I think I'll leave it to you to share some thoughts on how this doesn't become a very concentrated play, and that access is available much more broadly and more affordably to researchers, to entrepreneurs, to students in the Global South. I think that's a key responsibility I would lay at the, on the feet or the hands of the companies that currently today have that hardware and cloud computing power. I do believe that a lot of that compute power has to be provided early on to labs in countries like India and other countries in the global south, to research institutions, not just the IITs, but the ISCs and AIMS and other educational research institutions across the global south, to entrepreneurs, to startups, I think at more affordable rates, so they don't get locked out and this doesn't become just a pure big tech driven game. Of course, from a funding standpoint, I think to the extent that the governments in the global south can provide resources to help alleviate some of that cost that obviously companies like NVIDIA would need to incur to provide some of this compute. I think that's a key part, but it shouldn't be just a government-driven effort, I believe. I think large private sector firms from within India and the global south should play a role, whether it's IT services firms, whether we have large conglomerates in India, I think that should step up. I believe there are news articles I've seen of partnerships between NVIDIA and, let's say, Reliance or Tata to provide cloud computing access in India. I would love to hear more about that, Vishal, maybe from you. So I think compute is one key puzzle of the competitiveness puzzle. The other piece which is related to this is the R&D piece. I think unlike the internet wave, I think to do anything meaningful in AI, you'll need research. There's a certain large amount of research that's being done, obviously in Silicon Valley, in China, in Europe. I think India is lagging on that. The global south broadly is lagging on that. And I think one of the key reasons for that, there are 2 or 3 key reasons I see in that. One is just access to compute. Instead of distributing compute across a lot, like in a very socialist way, I think we should focus on centers of excellence, concentrate some of that compute access to certain institutions or certain groups that have proven their mettle in being able to use that effectively, use that compute effectively. I think the second piece, I think Debjani, you pointed to, talent from the global south often goes to Silicon Valley, often. And I think that's a problem we've got to solve if we want to do great R&D here. As you rightly mentioned, many of the researchers who did the famous Google paper were of Indian origin. Many of the researchers today sitting in, the OpenAIs of the world are of Indian origin, and I can extend that to global south origin. We've got to find ways to bring them back. For that, I think, again, building the right innovation ecosystems in our universities, in private and maybe government collaborated labs, like the Los Alamos type labs, I think have to be built in the global south as well. And that's a key component of building competitiveness and also making sure that we solve problems that are our problems. Otherwise, I think any country naturally will solve problems that are front and center for them. For the US, it's labor replacing applications of AI that are paramount, because for them, labor is a shortage. For us, labor is in abundance. We've got to find labor-enhancing technologies that we emphasize in our R&D. Talent I've spoken about, but that talent piece is going to be a key element of competitiveness for the global south. I think data, people have spoken about both the data commons, data freer data flows. I will add just one point on the data piece. I think whether we get global AI governance agreements or not on data ownership, data IP, I think we need, as a global south, need to build more movement around making sure that data is just not used without any regulation, without any ownership rights being afforded to those who've developed them. And that ultimately, if we get the data, the R&D, the compute and the talent pieces right, get these 4 building blocks right in the global south, then I think we'll naturally see the applications coming out of them, because we have enough entrepreneurs, enough venture capital here. And to me, if we get these 4 or 5 blocks right, then I think we will make sure that we are at the table when it comes to governance, and also ensure that it's human-driven AI and globally inclusive AI.
Thank you. Thanks, Mr. Suri. You have already passed on the baton to Mr. Vishal Dhupar, and and I think he has already said what you need to speak. So you have some points to respond to in your 4 or 5 minutes that are there. So over to you, Mr. Dhupar.
So I think what Anirudh has said, I can obviously answer it by Q&A, or I can alternatively speak like an observer of India, listening to all of you. I'll probably do the latter. As an observer, it's crystal clear to us that we are trying to establish 2 possibilities. Firstly, the gateway to Global South, and secondly, learn from Global North. Obviously, we realize there's a lot of work that has been done in Global North, which is going to be impacting this very big change that ought to happen. I think the debate around it, whether it'll happen or not happen, is over. It ought to happen. When it happens is just a question. What is this change? For the very first time in last 15 years of our entire human history, a brand new categories got formed. 15 years back, we said, we have now come to a realization that we can augment the work of our software engineers. It meant music for Indians, because if you can augment the work of your software engineers, it basically means you can be more productive, you can now improve the economies not only of your country but globally. Through that journey, which was a journey of understanding how do you classify things, how do you find out in that messy data, more difficulties, more noise, and translate that, a lot of good things happen, and the world, which was the Global North, figured out, hey, I have to overcome those challenges. And it took you, because of scaling laws, to a place where augmentation of humanity is upon us. And the augmentation of humanity is upon us in the natural language that we speak. Now, a lot of people get confused about large language model means the language you and I speak. That language is meant for us to speak to the computer so that we can teach the computer. But what the computer is doing for us is that it's actually telling us the meaning of all mega challenges, grand challenges that we are facing, the unraveling of the world. Take an example. Just like you're talking about governance, we are also talking about climate change. If I have to understand climate change, it would take me the entire computing the world has to get you to 1 kilometer by 1 kilometer resolution to tell you that this afternoon in Pragati Maidan what's going to happen. And we can't afford that. But because of this augmentation that is taking place, I can predict for 1 pixel, which is the floating point, I can predict another 64 and compress that information. Now the big question is, what is in for India? And in for India is 3 things. Firstly, the method, which is the enterprising vision will attract the researchers. We did that with Aadhaar, because Aadhaar was not treated as identity. Aadhaar was treated as a root cause to solve the problem of a prepaid economy to a postpaid economy. And we started opening the line. So similarly, if our vision is clear, safe human, a healthy human, increases an economy, then let's sign it up and attract those researchers. But getting researchers alone based on vision is not going to help unless we give them the tool to do the work. Now, why is that tool important? Because when they will put it into deployment in India for India's gain, there'll be dimensions of problems that will emerge. Learnings will be different. And that's what you're talking about, taking to Global South and contributing. When we did the UPI part, and why the chaiwala in Nariman Point is no more interested in cash but asking you that just transfer money so that he saves time going to the bank, and instead of wasting the time of putting his money back, he's able to make more money there. Similarly, those will be the learnings that will come from scale. And we will be able to then participate with the global north to say, hey, these are my unique problems. And we will, because that's the history of our country, will figure out that within those constraints, how do we solve that? And that combination of coming with North and South together will help you to adjust. What Devjani rightfully said, that look, you want to talk about regulations, let's talk. Make it baseline. Let's pay attention to what the world is doing. Absolutely do that. But then you'll have to bring onto the table on precise thing what is impacting you. Your language is different. The world says that, look, I have now taken the language, broken that into tokens. I'm putting those tokens into compute, and the compute is basically bringing the intelligence, but your words are different. Your structure is different. So we need to basically start from there, and that will help a lot of people doing it. I see you telling me to hurry up. So in nutshell, I think it's an ability to bring the vision followed by compute. The know-how is available, apply it, and hopefully we have a reason to prosper together.
Thank you. Thank you. Thanks a lot. I think you have clarified this cluttered vision that was emerging in terms of how we go forward. In a way, if I can capture it, you said South should set its own agenda. We should set our own priorities based on our requirements. And that's exactly based on our experiences and our insights. So let me bring this next to you, Jaya, in terms of how you look at the task that already Mr. Suri has mentioned in terms of how you define it. But as you heard Mr. Duper taking that element of endogeneity based on our own experiences, how you see this question?
So, you know, the transformational and pervasive nature of this new technology that we are all talking about makes partnerships and how we come together, collaboration, a key element to how we progress, or, you know, how we go forward with including the entire world with us. So there are a few requirements that AI has. Of course, one is compute, and no one can ignore that, as Anirudh, you rightly pointed. I mean, this is one of the key criteria or requirements for AI advancement. And of course, compute, when we talk about compute, it is an expensive affair. I mean, when you look at the pyramid of industries, the top ones can, of course, afford the compute infrastructure that's needed for development. But who gets left behind are the small and mid-level industries that need that collaboration and help, either from the government that can invest in more infrastructure and hand it over for developers. And also, we have to move towards open and collaborative platforms, open source platforms that will aid the developers to really innovate and learn and develop. And the other key part is talent, right? India especially has a vibrant talent pool, and we have about more than 500,000 engineers graduating year on year. But the key is, how do we convert this raw talent that's coming out of schools to skilled labor that is required by the industry? So there's a lot of good work that has happened, but more is yet to come, because AI is something that we're all learning together. You know, so academia partnerships with government and industry becomes key to this. I mean, India truly has the potential to not just meet our own demands, but to supply talent to the entire world. And the other one is startups. I mean, we can't ignore the roles of startups, especially in an innovating new technology or environment that we have. So startups also need similar help, and this is where MNCs who have already established and have the skills can really help with some joint partnerships with some startups. And the last but not the least is a global partnership to define a framework that we all believe in and are committed to for using AI in a very responsible, safe, and ethical way. I think all of these are very key for us to take AI forward for the benefit of humanity. Thank you.
Thank you for very, very precise and very impactful intervention, I would say, Jaya, in terms of the challenges of our collective learning that you have highlighted. I think this is very important. Let me now turn to Microsoft and to Kalika, to you. In terms of what limitations we see in terms of scalability, something that people have been referring to time and again. And from the position that you are in, you must have seen the kind of limitations which are there. How we see the AI revolution which Jaya just mentioned in terms of we all learning together, but then what are the challenges? And within the global south context, what kind of options you see in terms of overcoming this?
So I will speak as a Global South citizen and not as a Microsoft, person, though obviously each is influenced by the other. And I agree with a lot of things that people have mentioned here. But most of all, I actually agree with Mr. Dhupa, because I think that in our hurry to kind of ride this AI wave, we are missing the fact that there are things that we can set as our own agenda. No, if we think about DPIs and DPGs, and we give Aadhaar as an example all the time, right? We didn't need any competitiveness with the rest of the world to implement a system which proved to be so successful that the world comes and talks to us, right? And here we do have an opportunity to do that. We talk about democratization, and I see like the people here, including myself, I'm a technologist as well, we talk it from the point of view of the technologist. So we are talking about startups, we're talking about, industry, we're talking about how to build skilled labor for the industry, for AI. We're not talking about the people who are going to use the services and the applied AI, outcomes here. I believe we are right now in a very, very unique position, that the first time ever in the history of technology that we in the global south have the opportunity to set the agenda for a technology that's transformative. Okay, so it hasn't happened before. We've never had a seat on the table. We might not have a full seat on the table, I believe we do, but we have at least a partial seat on the table, and we can, put forward our point of view. We have the opportunity to make lives easier, to actually decrease inequity in the global south with the help of this technology. And that is something we really need to put on the table and make others think about. So when we talk about, say, harm and bias mitigation and all these kind of things, and we talk about socio-technical AI development, it's absolutely clear to us who work in this area that current methods, current data sets, current systems that are available do not work for us in the global south, right? So we should push forward for a more multilingual, multicultural, approach or a framework to look at all these things, right? And it can't be a unicultural and just a single language thing. The other thing I have to say about the regulation is that while it might be too early to regulate things, I have seen regulation also work as spurring innovation. Now, for a lot of us who remember this, as machine learning, a lot of us started as machine learning, scientists or researchers or engineers. In machine learning, our biggest issue was when enterprises and other organizations came and said, we can't let you see our data, but build this for us, right? And there was an uproar. What do they expect us to do? How can we do anything without looking at the data? They won't even let us look at the data. Very soon, we came up with ways to look at eyes of mechanisms to use the data to build the models that were actually useful. So I think if you have to kind of pay attention to what regulations make sense and what regulations do not make sense. So there can be regulations which spur innovation, which allow people to think differently because they cannot do it in a very straightforward, let's go ahead with this and jump into the bandwagon kind of a way, right? So I believe that is another thing. The limitations right now that I see, to answer your question directly, and that's the last thing I'll say, is to do with what everyone has said, data being available,
right? Also to do with the fact that doing AI building, inference, everything costs a lot of money. And who is the person who's going to bear the cost of this? And to come back to the competitiveness of it, which commercial entity will bear a major cost if they're not going to be able to get any return on investment? So we have not been able to articulate that other than social good, which a commercial entity is not interested in social good, right? That's not their responsibility. The government is responsible for the social good and the welfare of the citizens. So how do we articulate what the return on investment for a commercial entity is going to be? And I would just like to end with one thing, which is about replacement of jobs. And I'm sorry I'm taking liberties with Henry Ford's example of, if everyone has ridden on a horse cart, it's hard for them to imagine what a car can bring to them and what are the harms and the positive aspects of a car. So taking that as an example, if we are going to replace, say, wheel makers, inns where horses are fed, the fodder for the horses, then we have to right now start imagining who are the mechanics, where are we going to get the components and the parts of the automobile. So all that has to be imagined now, and now is the time. And it's actually exciting because here are we, all of us, talking about this. This has never happened right at the start of a technological wave that we get together and do this. So I'll just stop here. Thank you.
Thank you. Thanks a lot, Kalika, for bringing forward several important points, and plurality. Your emphasis on plurality, I think, is extremely important. The idea of multilingual, multicultural dimensions to be factored in, and then, of course, your response in terms of a replacement of jobs. So this, I think, those who are grappling with waves of technology, particularly the frontier technologies, are very well sort of aware of that. So let me now turn to Annabelle Lee. You have been sort of concerned in terms of the AI human resource ecosystem, or issues that you think are important that we heard just now from the Global South, the limitations of the skill, how we see those skill limitations. So any perspectives that you want to share with us in 4 to 5 minutes?
Me to be at this panel today. I hope I can be heard now. Great. I'll try and be quick because we've lost some time to technology issues, which is part of, I guess, the conversation we're having here today. So I actually wear the head of Southeast Asia Public Policy for Amazon Web Services on top of the digital policy file which I hold. And so I will be looking at this perspective from the Global South, but beyond India as well. And I think a lot of what was said today at the roundtable really resonated with a lot of our lived experiences, being a technology service provider, working very closely with startups, with SMBs, and with governments all across Global South countries. When I take a step back and think about AI, and specifically as well generative AI, and the kind of potential it can have for the Global South countries, I think it truly is a leapfrog opportunity of one. Maybe we have, the last time we saw this scale is mobile phones and mobile connectivity. Something else has come on. Okay. And from my perspective, I think that I will start there in terms of when we talk about access. We forget that not only do we need compute, we still do need networking. And in fact, I will go as far to say is that compute is available, and as cloud service providers, as hyperscale cloud service providers, what we do every single day is make that compute available, and that includes for AI. And so a lot of our startups are able to come on board very quickly at a relatively low cost to train, fine-tune, and deploy AI technology. So this is available regardless of where you are based. You could be based in Mongolia. You could be based in, Uzbekistan. You could be based in India, right? And we have, as long as you have internet connectivity, you will be able to access the cloud. So that's the good news. But the bad news is that I think internet connectivity is still not available everywhere. So until we solve that first problem, and I know it's a difficult problem, we do have low Earth orbit satellites coming in and all of that might help to bridge that gap. But I think we will still have an access issue. But the good news is that that access is not strictly on compute. I think the second piece that we've been talking a lot about is skills. When we look at the skills issue, I think generative AI in particular has done something truly amazing. Now, I'm just going to give an example. I'm not a technologist. I'm a social scientist. I have no idea how to code. There are probably people at this table who, are geniuses compared to me in terms of like using a computer. But the technology of generative AI has enabled people like me to be able to build an application with natural language. And so just to use AWS's services for an example, there's this thing called Party Rock. I don't know why we called it that. It's not very intuitive in terms of naming convention, but it enables you to, as an individual who only speaks, normal languages, to be able to type into the service an application you would like to build, and the generative AI can actually build it for you. So that really does, when you think about democratization, that democratizes the technology to a whole different level, right? And it means that it can augment you at different levels. If you are a computer scientist, if you're a software developer, but you're not an AI scientist, there are technologies today that will help you be more of an AI scientist. But if you are, a common person like me with zero coding skills, you can somehow build an application as well. So I think the key is to ensure that we get the trainings and skills that are needed, at whatever layer, out to as many people as possible. And today we've already done, as AWS, I think a lot of other companies at this table also have similar things, a lot of free skills training that exists. The interesting thing, and it's also existing in many different languages, by the way, but the interesting thing we've seen is making it known to the people on the ground who could benefit most. And I think that is something that, the global south, if we want to think about agenda setting, how do we use ways and means already existing in different countries to get the reach further out? So I think that's a second piece on skills. And finally, when we talk about, and I'm going to use this, I think speed is another very critical piece for the global south. Why do I say this? Because with every new technology revolution, and we are right now in one, if you move faster, you have first mover advantage. I think we're at the stage where it's kind of a equal playing field for most users and developers of AI today. But if we do not, as the global south, think about how do we ensure that policies and kind of government support is enabling that speed to happen, we could fall behind again. And so maybe the last thing I want to say is that when we think about speed, I think the most important thing here is not to reinvent the wheel too much. Look at what exists today already: compute, networking, power, the skills, finding the right mechanisms, whether that is through platforms like UNSCAP, who we've been working with as well, some of the development banks, ADB, the World Bank, the Global Partnership on AI, finding these organizations that already exist and ensuring that we're putting the programs through them. And I think, candidly speaking, from the private sector's perspective, we can be a bit more organized. I think that's maybe the problem. We've been very ad hoc in terms of our approach. If we see a program, we try and put it in, but we're not really thinking what can we do at scale. So I'll put forward that these are the main things that have to be on the agenda. And a final last data point I want to just show to make everybody think about how it is actually possible to get things done quickly today is the example of Sea Lion. I don't know if anybody has heard of Sea Lion. This is the Southeast Asian, so ASEAN, the institution is building a large language model, and it is intended to be a large language model for commonly used Southeast Asian languages. And this includes Thai, includes Bahasa Indonesia, Bahasa Melayu. This is already being built, and AWS is working with them to build this, but more importantly, I think we were able to do this with them very quickly. So it's about ensuring that you're building that LLM if you want one, finding the right fund sources, and in a lot of cases we do co-fund as well, to make sure that we're actually going to enable that first piece so that very, very quickly your startups, your government agencies have a really good fine-tuned large language model that you can use. And that's just an example, but I want to inspire everybody because I felt it was getting a bit of a downer, like, there were so many problems we're trying to solve. I do genuinely believe a lot of this is solvable. So thank you very much, and let's put all of this on the agenda.
Thank you. Thanks, Annabelle Lee. I think you're absolutely right with your reference to first mover advantage. And I think the whole literature that came up in profession of economics about catching up and falling behind is something which is, with this technology at least, is playing out in a very different way. Good that you mentioned about the regional initiative from ASEAN in terms of its governance and also enabling countries to participate. So thanks, Annabelle. Let me now invite our colleague Matthew to you in terms of how you look at this implementation and high impact AI projects that you think Global South may think of. So over to you, next 4 or 5 minutes.
Thank you. I'll try to be brief because I know we're a bit over time. But I'll start with a question, is that we're all talking about solutions and ways we feel we're capable of enabling AI to be accessible and to be democratized. But I think that, we have 3 of the biggest like tech companies around the table and a few government representatives. And my question is, how come we all agree on the ways to do it, and those solutions are actually not implemented? So I think there's a problem regarding political willingness, maybe. But the question of inclusivity of Global South is a very important one, because they might be the most affected population of this transition that is promising to increase productivity and automate a lot of jobs. And it's a complicated one as well, because our role as rich countries is not to bring their voice to the table, but rather to support them to bring their own voice in the global AI discussions. We cannot be the bearer. They know what they need. They know what needs to be addressed and changed. But the problem is that for most of those countries, there is a very limited ecosystem for them to actually be able to use the opportunity that we are trying to bring. Open science, open source, and access to AI programming tools is great, but if you don't have the capacity to use those opportunities to create the positive impact we're looking for, it's of little use. So we need also to invest and support developing countries in creating their own ecosystems. Previous speakers have already talked about this, so I won't get over it again, but it comes through education, upskilling, and capacity building. Our approach at CEMIA is to have, to develop initiative with local stakeholders as lead of every initiative we are supporting in developing countries. We want to use AI to address real challenges faced in developing countries, but to do so, we need to work with people that are living these issues and that have a foot on the ground. So what we decided to do is to do this by building on the microcredit initiative. So with people in those specific countries, we identify challenges that can be addressed with AI and create micro AI projects that can ideally be afterward be implemented and then scaled up to other regions or other countries. But I'll go back to my first editorial note, and maybe I'll throw a brick in the pond here. But there's a lot of talks about democratization and global collaboration, but in reality, everybody is actually trying to pull on their side of the sheets because there is so much attention and money in play. We see most regulations being adopted or in the process of being adopted or drafted. They're mostly about regulating the market instead of truly trying to protect the people, and even less about sharing the positive impact. I think that, again, there is a lack of real political willingness because of the premise of wealth creation is putting a lot of pressure on regulators to get the biggest piece of the pie that they can. So as long as we approach, I think that as long as we approach AI regulation as like an economic issue instead of a global social issue, we will miss this opportunity to reduce social gaps and might actually end up widening them. So if we really want to be collaborative and address this issue as a global one, as we should, we need to do everything we can to make sure that the upcoming transition, because there will be a transition, is as smooth as possible and as short as possible.
Thanks, Matthew, for being so precise and clear in terms of what the roadmap should be, something that should be raised in terms of workable roadmap. So I think it's an excellent contribution to that. Rudra, I have been told not to ask any question to you, but I am so delighted that you are here on this panel, and I think you have been one who has been connecting rise of these technologies and the geopolitics that comes in along with that. It poses several different questions, and I think answers are not simple. As we heard, people who are engaged in technology development, social scientists who are into the role of technology governance and its dissemination, the catching up and the falling behind question. Global South is at multiple levels of development. There is no uniformity. And then we heard Mr. Duper mentioning in terms of why it is important to articulate our own difficult situations and our past experiences to see that technology speaks what we have gone through and what we are looking at. How, Rudra, you see this whole question for Global South and what solution you have for us?
I thought you started by saying you're not supposed to ask me a question. I'll just make 2 points. I think one is the point that Devjani made and others alluded. I think in this game I think clarity of purpose is going to be very important. When you're in the Valley, I was in OpenAI in the office about a month ago. It's a whole different universe, right? Where we are is a whole different universe. And I think here we really do need to take a leaf off the GPAI page of the book. There was a specific problem that was given to a specific group of people to solve. They solved that, which then evolved into other problems that they could attach and reuse and be interoperable and so on and so forth. And I think that's very important. Yesterday I was in a room with 40 Nigerian diplomats. We were talking about AI, and it was interesting. The question they asked is, what is this for? How is this actually going to help us? They asked the same question on space, saying, why do we need to invest in a space program if I'm in Lagos? And they said, what do I need all this compute for? What's it going to solve? And I think that's a really important question from the Global South. The second, I'll just push back a little bit of what kind of Kalika said. I don't think we're setting the agenda. I think we should be clear-eyed about where we are. There are many different conversations happening on AI. Many different agendas are being set right now. I think we could set the agenda. And there's a way in which you could do that collaboratively if you organize this. And Mr. Singh's here, who's put all of this together. So I think the next stage of this is, how do you actually use this to shape the agenda? So take one example. There's a lot of buzz around the Safety Institute process today. It's a serious thing. When it started in Bletchley, people were unsure. When it moved to Korea, it became a very serious thing. So Singh, I think, was at Korea. This is going to proliferate. So can we use this kind of a process to channel the needs of the Global South, as it were, for instance, which has a very different appreciation of privacy and risk, for instance, in situations such as that? And there are any number of other examples, for instance, but I just wanted to bring these 2 points to bear. The last one, just for Jerry, I'll say, is my own sense is we should just be very careful in this collaborative affairs when we think of DFFT, etc. Right? That brings up a whole different can of worms. It's a whole different set of issues. There is no consensus around those issues. And frankly, I think we don't need consensus because everybody's got what they want. I don't think there's a tech company in this room today talking about data localization in India, right? Rewind 2 years ago, very different scene. So I think the way we think of grammar and the way you shape these agendas are going to matter equally. Thanks.
Thank you. Thanks, Rudra, for bringing forward the expectations, hopes, and also reservations that several global South countries have in terms of investing and prioritizing within the technology. And let me at this point also acknowledge presence of Mr. Abhishek Singh. Thank you. Thanks for joining in, the Additional Secretary with MITI, somebody who has been thoroughly engaged in terms of how this trajectory of discussions and ideas around this whole get-together comes in. Maybe should I request you to make some observations and share your perspective before we close?
I'm more in the listening mode than trying to imbibe the wealth of knowledge that exists in this room with the experts on the technology field, as also authors and everyone. And Jerry and Matthew will be there in the discussions all along. So I would prefer to listen more today and maybe discuss over the dinner or something for want of time.
Thank you for joining us today, and good that you are in this room. There are competing commitments here. So I think friends and colleagues, we have already overshot time. Some summary that I was thinking in terms of presenting at the end of the this discussion, thinking in terms of what solutions are there. But as you have heard, Global South is not a homogeneous entity. It's the heterogeneity comes in terms of technology development, in terms of those who are still in the mode of catching up, countries where expectations, capacities, and dimensions of engagement vary, and they are also in terms of how they see the compute capacity, the skills, the budgetary allocations that their governments have to make, even the ability for startup financing that are extremely different. Only a converging point that emerges for the Global South is in terms of their expectation for AI to be safe and trustworthy. And that's where the whole emphasis on ethics lies. So I think some of these dimensions, if at all they go in, what Debjani said in terms of the minimum denominator for governance component. And that's where the dilemma and the challenge lies. But there is also opportunity. And as I gave example of similar reservations which we have seen over last 20 years about biotechnology and frontier technologies per se, there was also huge uproar when we saw convergence of biotech, nanotech, and ICT. You remember the NASTI was constituted in OECD, and we saw a new working party coming up to see convergence of technologies and multiple forms of governance that were there. So I think those of us who are in the field of technology governance and economic development have seen waves of these urges across from different quarters to allow innovation to prevail, governance to prevail, and there were several Global South countries, Rudra, who opposed inclusion of intellectual property rights back in 94, 95. The whole Uruguay round in WTO has seen assertion by the Global South to see that IPRs are not sweeping. But now you find technical talent within the Global South also urging for intellectual property protection. So those debates and their rise and their fall, we have seen as competitive advantages of countries have changed, economies have changed, and so have their priorities and concerns. But today, where world is converging in terms of AI is in terms of its ethics. And I hope the work that UNESCO's guidelines have taken forward, what I mentioned in the beginning of the G7 and G20 priorities, the priorities that Mr. Rohit Ratish mentioned in terms of public-private partnership, the DPI related issues, but as Kalika very rightly said, more competition, more skills, and that's where the dimension is. I fully agree with Mr. Dupayu in terms of we bringing forward our own expectations, articulation of our past and our value systems. And that's what I think imbibe within the technology's language that we expect it to speak. So with that, I thank all of our panelists, big hand for them, for their contribution, excellent opening remarks and the initial remarks that we got. So I thank, and back to you, Shani. Thank you.
Thank you, everyone. I'll request Joint Secretary Sushil Pal, sir, to please felicitate our speakers here. Beginning with Shri Rohit Ratishji, Joint Secretary MEA. Our moderator for the day, Professor Sachin Chaturvedi, Director General RIS. Ma'am Devjani Ghosh, President NASCOM. Mr. Jerry Shihan, Director OECD. Ms. Kalika Bali, Principal Researcher, Microsoft. Mr. Anirudh Suri, Founder, India Internet Foundation. Mr. Matthew Marcotte, Director, CEMEA. Dr. Shubhi Chaturvedi, Digital Policy Officer at InMobi. Mr. Vishal Dhupar, MD, South Asia NVIDIA. Ms. Jaya Jagdish, Country Head, AMD India. Ms. Annabelle Lee, Digital Policy Head for AWS Asia Pacific. Mr. Rudra Chaudhary, Director, Carnegie India. I would also request Abhishek Singh sir to kindly felicitate Sushil Palji for his support. Thank you all speakers.